Hello, YouTube. Hello there. Let me start Facebook here. I want to make sure our streams are really clean and crisp. Better be. I got to push this down a little bit. There you go. YouTube, you are good. We made it. Hello, 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 everybody. Jill Osborne from the Interstitial Cystitis Network. It is Sunday, July 23rd, and yes, I am here this week. I was not here last week because my right eye was swollen shut. I'm telling you, 2023 can just go to heck as far as I'm concerned. We need to be done with this year. I had my eyes checked. They told me I had dry eye, and I got an infection from the eye exam. So anyway, it's all better now. My eye is open now. Hello, Donna. How are you, hon? So I'm sorry that I wasn't available last week, but that's okay. I think we all need breaks. And of course, it's the summer anyway. And during the summertime, most support groups shut down. And I think it's very important that we all understand that IC support groups right now are slim to none in the United States. And the reason why is because of COVID. Most of the groups shut down during COVID, and they have not started up again. I would like to say that we will have more support groups. But I think it's going to be a while. It's going to be a while before support groups get up and kicking around the United States again. At one point in time, we had support groups in almost every state that met in person, but not so much anymore. One of my dreams, of course, is to have another national conference where patients can come. The last national conference was probably 15 years ago. Long time ago. Doing national conferences are very expensive, and in the end you realize that the only people who can come are people who are well enough to travel, and frankly, are those the people you really want to come? The answer is no. You want to reach the people who are not doing well, and that's why internet support is so incredibly successful, because we can bring patients, the best researchers, the best of everybody in the IC world directly to your home. And that was my intention when I started the IC network 30 years ago, because hello, it is our 30th anniversary. How did I get so old? Hello, Gay. Nice to see you. I'm doing much better now. Much better now. I was just working so much at the computer, and, I'm frankly just kind of hiding with my iPad on kind of rough days. And I just massively dried my eyes out, and that just didn't work. But anyway, things are better, really helping sleeping. I now have a humidifier in the room I sleep in, and that's really helping quite a bit. So anyway, when I started the IC Network, that was my goal, to bring the world's best directly into your home. And that's always been my goal, and I will continue to do that in the coming years. A lot has changed in the IC world. Old treatments are now kind of not being used anymore, such as Elmeron, if you haven't heard. In addition to Elmeron associated with retinal disease, Elmeron is now also associated with inflammatory bowel disease, so severe that in some patients they've had to have their bowels removed. This was research that was developed at the Emory Eye Center. As they were doing the eye research, they were able to establish that many of the patients they were working with retinal disease also had inflammatory bowel disease. There's a lot of research going on that right now around the country, but that is how do I want to say this? Another tragic consequence and failure of pentose and polysulfate, this specific medication. My degree is in pharmacology, which is drug development, and it's so incredibly important that we all understand that the human body is remarkably complex, and the arrogance of pharmaceutical companies today is that they think that they can, there's not a sense of humbleness. The human body is a miracle. The human body is so complex. There are so many interesting, fascinating processes happening. And so we all know that the bladder has a gag layer, a glycosaminoglycan layer, which acts to protect the surface of the bladder. It makes it so that stuff in your urine can't irritate your bladder. It makes it hard for infectious pathogens to infect your bladder wall. But did we know that there were glycosaminoglycans in the retina? We didn't. I didn't. Ironically, when Elmaron was approved in 1996, I decided not to take it. It just didn't make sense to me. My big issue is, if you swallowed a Band-Aid, would you expect it to come out the other end of Band-Aid? And the answer is no. We have digestion, and the fundamental flaw with pentose and polysulfate, also known as Elmaron, is that more than 90% of it is destroyed by digestion. Thus, only, less than 10%. Some doctors have told me 5% of Elmaron actually arrives in the bladder where it can do anything good for the bladder. It acts as a chemical Band-Aid, a chemical coating in the bladder. And that's why you have to take a lot of it over time for it to develop a coating. But now we know taking a lot of it over time can also affect the eyes, can affect the retinas, and now the bowel with the inflammatory bowel disease. So, when we think about changes in the last 30 years, we always have to think about corporate influences. And one of the challenges that we've had in the IC world is that interstitial cystitis bladder pain syndrome has never been considered particularly profitable. And so there have not been a lot of companies coming around who have the millions and millions and millions of dollars to try to develop a new medication. And I will say that for the majority of companies that have tried to do that, their research has failed spectacularly. Why? Because you can't put apples, oranges, and bananas on the same treatment and expect success. And it's really kind of a miracle that Elmaron actually received FDA approval by itself, because it wasn't like it was particularly successful either. It was just a little bit above placebo. And of course, now we know why, and that is we have subtypes. We now very clearly understand that there's distinct patient groups in the IC patient population, which has been why so many companies have lost so much money trying to create a new treatment. And I work with new companies all the time. We're trying to enter the IC market. And I had a very long conversation with a new company, and it's like, guys, I want you to succeed, but you're not going to succeed if you don't phenotype, if you don't subtype. Do not waste the millions of dollars that other companies have wasted putting Hunner's lesions, pelvic floor driven, estrogen atrophy, chemocystitis patients all in the same study. It's not going to work. And so, and they're listening to me, which is great. And in fact, at our National Institutes of Health research meeting that happened last fall, that was the point that I made as my part of the discussion is we have to create an easy pathway for success for some of these researchers who are trying to create new treatments. And the only way that we can do that is if we really emphasize the importance of subtyping, phenotyping. Because the Hunner's lesion patient is not going to respond the same way that the pelvic floor patient is doing. And the key question that the researchers asked me is, well, should they phenotype before they start the study, or should they phenotype the data afterwards? And my answer is always before. Before. Do not expect them to have millions of dollars to study the intricacies of this pelvic pain syndrome. So anyway, not that you needed to know all that. And so when we think about oral medications now that are often suggested for interstitial cystitis, we've got a low-dose antidepressant amitriptyline, which can help calm nerves down if you've got neuroinflammation. We've got a low-dose antihistamine, hydroxyzine, also known as Atarax or Visceral, which can help calm some of the irritation in the bladder wall. We've got, particularly for patients who have pelvic floor-driven symptoms. Hello, Peggy. We've got skeletal muscle relaxants like Flexeril, cyclobenzaprine, Valium, or baclofen. For patients who are struggling with a lot of urinary frequency, urgency, we used to do ditropan or Detrol, also known as oxybutynin. That's the ditropan. Of course, we now know that this type of medication is more associated with cognitive decline. It's an anticholinergic. So there's been a lot of backing away from ditropan and moving forward to something called Mirbitric, which is not an anticholinergic, which might help calm some of those symptoms of frequency urgency. But ultimately, in the end, you as a patient should not be chasing your symptoms. You can spend years chasing your symptoms. Chasing your symptoms is not going to get you where you need to go. It's always about trying to understand underlying causation. We have to try to figure the symptoms are the effect. We've got to figure out what's underneath the symptoms that are driving the issue. So on this week, I had a really interesting conversation with a patient that I've known for many, many, many years. She's a very, very severe IC. She's always had to do bladder installations before work, even sometimes during work. And she's somebody who I'm in awe of for her strength. I told her this, she did things that I don't know if I could have done, like bringing installations to work and doing them in her bathroom at work when her bladder was really screaming at her. And so here, her entire life, she's been dealing with what I consider to be really, really, really severe pain. Now, what's very interesting is she's certainly aware of all the pelvic floor work and had been asking at least one doctor, do you think I have pelvic floor dysfunction? And the doctor went, no, don't waste your time. But she understood over the decades she was chasing symptoms. She wanted to try to figure out underlying causation. So she went to a pelvic floor physical therapist anyway. And you know what they found? Massive pelvic floor dysfunction. She had trigger points so severe on her inner thighs that she was bouncing off the table. And that physical therapist was just absolutely appalled that a doctor told her that she did not have pelvic floor tension when she actually had a very, very severe case of widespread pelvic floor tension. And I'm really, really excited for her now. Now it's about working, being able to get time off work, to be able to go to physical therapy, which is a bit of ways from where she, it's like a 45-minute drive, and she's going to have to try to make that happen. But I truly believe that when we go back in time with her, it began with a pelvic floor trauma. She also shared what was very interesting about her case. Obviously, I'm not saying her name. If you're watching, I love you, and I know you wouldn't have a problem with this because we've actually told her story before in our magazine. When she was a child, she could not run around the track in elementary school without leaking. And she never told anybody. She hid it from her mother. She hid it from everybody her entire life. So as a child, she could not run without leaking. And so that tells us from childhood, there is a real fundamental problem with her pelvic floor and her pelvis and her incontinence. So I want you to be really, really inspired by her case, because here's a woman who really had come to accept that her life would always be limited by this. And she's like me, single, didn't have children. I didn't have children because when we were in our 20s and 30s, we had real severe pain. That there is a huge, huge chance now that we can finally get to the underlying problem and fix the underlying problem. And as I shared in my email that I sent out this week or last week, you know, I'm symptom free now. I am again. What is this? Lemonade. I haven't drunk lemonade in 30 years. Honestly, 30 years. Exactly 30 years. And I got COVID real bad two months ago, was coughing like heck. Would never have dreamed that I could tolerate lemonade or cranberry. Never. The COVID was real bad, coughing like a beast, driving home from the hospital. Oh my God, I need hot lemonade and Manuka honey. Stopped at the store, got it. Didn't flare. Doesn't flare. Why? Because my bladder now is healthy, because my muscles are finally healthy, and we now have good blood supply to my bladder wall, and my bladder wall has healed. Have you ever heard the term ischemia? ischemia. Ischemia. Ischemia is oxygen deprivation. It's damaged blood supply. So if somebody has a catastrophic injury and the blood supply is cut off to a hand or a finger, bad things happen. You might lose it. If it's really, really severe, the tissues start to die. Well, the long-term consequence of tight pelvic floor muscles is ischemia. If your bladder is supposed to get 24 units of blood a day and it's only getting 10, are you going to have a healthy bladder wall? And the answer is no, you won't. That's why you're diet sensitive. People always ask me, well, why am I diet sensitive? If you say I'm muscle, it's like, because you have ischemia. It's impossible for your bladder to be healthy if it doesn't have good blood supply. So, I want you to be inspired by her story, because finally, they may have gotten to her underlying cause, just like they got to my underlying cause. I was working with a patient this last week who, such an interesting case, because, again, I work with so many of you now. You kind of get all mixed up in my brain, and I deliberately do not take notes because I don't ever want to violate anybody's privacy. We were trying to figure out why her pelvic floor was so tight. I mean, she had astronomical pelvic floor tension. And no matter what they did, her pelvic floor continued to be extremely tight. And again, we always go back to that concept of trauma. And it turned out that when she was 6 months old, her leg was broken. And anytime you break a leg like that, the odds are it's going to be a little shorter than the other. And in fact, her pelvis was tilted. And she did. Okay, that was a weird noise. Okay. I am alone in the house. There should be nothing else here, but it is a little windy. So here she's got a catastrophic injury in childhood. Her entire life, she has had a tilted pelvis. Is that playing a role in her bladder symptoms? Absolutely. And she never made that connection. It was just so interesting. She never, ever, ever made that connection. So for you as a patient, don't get lost in your symptoms. Don't get lost in chasing your symptoms. You have to kind of take a step back from chasing your symptoms. And we have to try to figure out underlying causation. I sent an email. I got to tell you, I sent an email to my European colleague. They had a big European meeting in July that I did not go to because I was recovering from COVID and I just wasn't strong enough to go. And in Europe, they consider IC a rare disease. Hello, Yvonne. Hello, Lisa. Um, and I just like, okay, it's very rare in Europe, but it's a very, very common here in the United States, right? 3 to 8 million women, 1 to 4 million men, according to our epidemiological studies. What's the difference? And in Europe, it's a very, very narrow diagnosis, and they rule a lot of stuff out. As an example, something they do in Europe that they don't do here is that they rule out viral infection. You know, Hunner's lesions, wounds in your bladder, the big mystery, what the hell's causing a wound in your bladder, the worst form of IC. These patients are down to eating 4 to 5 foods, are living with very, very severe pain. And we got a really big clue as to what could be causing a Hunner's lesion, and that is a viral infection, the polyoma virus or the Epstein-Barr virus. And in fact, at that very meeting, we had our first study, and actually came from China. It's a really good study where they did next-generation DNA testing of the urine of patients with Hunner's lesions. They found Epstein-Barr in the great majority of them, and they treated it with an antiviral. For the first time, we have a study that's assessing the use of an antiviral for Hunner's lesions. And you know what? It was successful. And after it was, I think, well, I can pull it up. It's going to be in our magazine, which is at the typesetter right now. I don't remember how long the treatment was. Might have been 2 months. Might have been, well, I can pull it up if anybody wants to know. At the end of this treatment with this antiviral, no virus was found. So I said to my colleagues in Europe, I said, okay, so if somebody's positive for virus, would you diagnose them with interstitial cystitis, or are you diagnosing them with viral cystitis? And my email was probably a little bit too challenging. You know, Americans, one of the things we have to understand is, and I don't mean challenging academically. I mean that Americans generally are perceived as a bit pushy, and they have been for years in Europe. Even among the researchers, the IC researchers, very the Americans years ago were very arrogant, very, very pushy. And I always have to really remind myself that I really have to back off. I have to back off. And so anyway, I was just like curious. Okay, you test for virus, so that's excluded from a diagnosis of IC, right? What about this? Is that excluded? As we try to understand how Europe considers IC a rare disease, and here in the United States, we consider this a very common disease. So we have a lot of work to do. But it's pretty cool. Good things are happening right now. Now, listen, we're simulcasting right now. If I'm looking here, I'm looking at Facebook. If I'm looking over here, I'm looking at YouTube. For Donna, for those of you guys on YouTube, just know that you're on slow mode, but it's only 20 seconds. It's not a minute anymore because we haven't been invaded recently by people. Sometimes people come in and mess with chats on YouTube. So I want to hear your questions. Anybody who has any questions out there, please give them to me. Normally, the way I do these meetings is I'll do a little 30-minute riff on something, and then I'll take your questions for as long as you have questions for me to take. Sometimes I read out of our book. Other things that are happening right now, again, our IC Optimist magazine is finally at the typesetter. It is a big double issue, our spring and summer newsletter. We've got IC Awareness Month kicking off in 5 weeks. And I really need some thoughts from you. I mean, as you know, listen, IC Awareness Month, even though we coordinate it, it's been very, very difficult the last couple of years because when September comes around, we're usually evacuated with fires because we're already having fires every day. So I have to keep the campaign pretty simple from my end. And it's kind of up to you guys to decide what you want to do with it. We'll have a press release. We'll have a, I'm not sure if we'll have a poster contest or not, to be quite honest. Poster contests were always the big funnest part of it, for people who are kind of creative. But I really need to hear some ideas from some of you as to what would you think we should be doing for IC Awareness Month. And normally I would be setting this up in June, but of course we were dealing with the death of my parents in June, so everything's going to be a little bit late. We have another big pelvic pain conference coming up in October. That it doesn't look like it's going to be covering IC at all, so that's probably a nothing burger. But anyway, lots of good things happening. Renee, thank you. It's nice to see you on. David, what supplements are good for overactive bladder? Actually, I was going to talk about that a little bit. And Danielle says here, missed you last week. You were not on. Anyway, my family is buying me an ozone machine to heal my pelvic floor. Any thoughts? I don't know how ozone would heal your pelvic floor. If your pelvic floor is tight, hun, it seems a rather strange approach to it. I would rather that you invest some money in hands-on physical therapy, because we know that that works. As long as those muscles are tight, as long as those muscles have trigger points, they're going to be messed up. Ozone is not going to fix a trigger point. Ozone is not going to relax tight muscles. It might help oxygenate some of that tissue, but I'm not aware of any research that would do that for you. So, Danielle, why are you going in that direction? I'm curious. So let's talk about the difference between, quote, interstitial cystitis and overactive bladder. Interstitial cystitis, interstitial cystitis has always been urinary frequency, urgency, pressure, and or pain, specifically pain as the bladder fills with urine that is relieved by urination. Overactive bladder is actually fairly new. And for those of you who are a little bit older like I am, you might remember those old TV commercials that were the gotta go right now commercials. Those were Detrol or Ditropan TV commercials. And I can remember they were talking about this brand new condition called overactive bladder. And I remember I emailed, because it sounded exactly like IC, except without the pain. It was frequency urgency with some incontinence. Now, typically IC patients don't have incontinence. Overactive bladder patients do, sometimes. But, it's a very slim difference. So I remember I emailed Dr. Parsons back then, and I said, so what is this overactive bladder? And isn't this going to make it a lot harder to diagnose interstitial cystitis? And his answer was, yeah, it's going to be a lot harder to diagnose IC, when in fact, a lot of people consider overactive bladder to be very, very, very mild IC. Generally, that frequency urgency is assumed to be being driven by nerves, maybe some nerve dysfunction. And the question is, why are the nerves dysfunctional? And the answer often comes right back to the condition of the bladder wall and or the condition of the pelvic floor, and or the presence of other pain conditions. So anyway, quite a few experts believe that overactive bladder is a very, very mild form of interstitial cystitis. Others believe that there is a fundamental difference, that it's a neurological difference. It is a cash cow for the pharmaceutical companies, because frequency urgency is incredibly common. And so that's why you see a lot of companies invested into meds for frequency urgency. I'm going to sneeze. Hold on. Sneeze, baby, sneeze. You see more companies that are investing money in overactive bladder than you are in, quote unquote, interstitial cystitis. With respect to supplements, in my opinion, you definitely want to stay away from UTI-based supplements. There are so many products online right now that are marketing. I mean, here's the thing, is that everybody's trying to make money. And listen, we all are entitled to make money. And when you talk marketplace, the urinary marketplace is a really big marketplace. And if somebody has frequency urgency, as you well know, it's usually assumed that you have UTI. And most of us believe that we have UTI. And most of us started buying lots of cranberry, took a lot of antibiotics under the mistaken assumption that we all had infection. We all did that. That's normal. But there are now companies on the marketplace who are pulling you in if you have frequency urgency, saying, hey, take my product. Maybe you just have infection. I can fix all of your frequency urgency. So product. I don't want to say a product name because I don't want to get sued, but products that you can drink, powders that you can drink for quote unquote UTI, wouldn't make any sense for overactive bladder. I think for overactive bladder, you want to be looking for things that would calm nerves down. And so I would be looking at, and I don't talk about this supplement very, very often, Cysto Renew. It's an older supplement. It's an older chondroitin-based supplement. And it was a transition from, so we had the first chondroitin-based supplement was Cysto Protect. That was a long time ago. Then the next product that we had was Cysto Renew, that was created by Dr. Gio Espinosa, who ran the Integrative Urology Center at NYU in New York City. And he was the first to bring in a nerve calming agent. And his nerve calming agent was lemon balm, not citrus lemon. A lemon balm is a mint with a lemony taste that has nerve calming effects. But now we have something I think that's even better than lemon balm, and that is we have PEA, palmitoyl-ethanolamide. And so, and Cheryl says right here, Cysto Renew is great. Yeah, and we have Cysto Renew right in the IC Network shop if you'd like to get it. And you guys, please, when you can, buy your supplements from us. And that way, your money is being used for things like IC Awareness Month. I know it's really easy to go into Amazon and click buy now, but the problem with Amazon is you're just patting Jeff Bezos' pocket. And at this point in time, I'm really sick of the gazillionaires who are, grabbing all the money. It's so frustrating for those of us with small businesses. And so if you can, come on over and get your supplements right on the IC Network website in our shop. It would be very, very helpful. Okay, now I have a lot of questions here. So hold on a sec. Let me go back here. Peggy says, I've noticed after I take a short walk, my bladder starts with pressure symptoms. So Peggy, anytime we have symptoms that are changed by movement, we always look at the pelvic floor. I know it feels like your bladder. Yes, you're urinating more, but that's the effect. We have to try to understand underlying cause. And I want to know what's going to happen with your pelvic floor. And you say here, you're going to have your first physical therapy appointment on the 16th. That's something very important that I want you to tell your physical therapist, is that your symptoms start after you start moving. Because the bladder symptoms are really not going to change with movement. Muscle symptoms will. Lisa, I hope you're playing some tennis this summer. Hello, Yvonne. Debbie says, I have Hunner's ulcer. Should I ask my urologist about an antiviral med? Debbie, in our magazine that should be out maybe late next week, I will have that research study. And if you want to email me, icnetwork@mac.com, I can send you that research study in its entirety that you can then take to your doctor and say, hey, what do we have to lose? I would love for you to do a viral test. And let's just see if I happen to have any active Epstein-Barr. And if they do find active virus, then an antiviral makes sense. And the research study shows that it's effective. Marlea says, I'm currently taking a statin. My doctor insisted, even though my cholesterol is only borderline, but it's making my joints and muscles hurt so bad. She says, take coenzyme Q10, CoQ10. I have atrophy. My bladder is super sensitive to everything. Used to ride horses, one leg shorter. I have it all. What do you think about me taking CoQ10? There shouldn't be any issues with CoQ10. Ultimately, in the end, I cannot get in between you and your doctor, and it's not my place to criticize your doctor or to suggest that what your doctor is telling you is poor. All I can do is give you a new set of questions to ask your doctor. And I think it's very important that you look at the side effects of the cholesterol medication and make sure you're not having other side effects associated with it. You know, I will say that my father never tolerated any of the statins. They made him so ill. And I remember he took them for about almost 10 years, and every morning he felt bad. And he just got so disgusted. Now, realize he lived till he was 100. He stopped all of the meds. He stopped the blood pressure meds, the cholesterol meds, and finally he felt good in the morning. And I think we narrowed that down to the cholesterol meds. So if you can, just Google it, look at the side effects, and have a good discussion with your doctor about it. With medications that are giving you side effects, you always have to ask, is this interfering with my quality of life? Because if a medication, for example, is giving you massive diarrhea every day, that's not tenable. That's interfering with your life. And if you find that a medication is messing with you so much so that you're not enjoying life and it's preventing you from doing things, that might not be the medication for you. And it's okay to ask the doctor and say, you should tell the doctor, hey, I'm really frustrated with this. I can't go do the things I can. And let's see if there's another medication that they can do, or some dietary changes that you can do to try to get that cholesterol level lower. Okay. Now, with the estrogen atrophy, make sure you're treating the estrogen atrophy. That's important. And the fact that you used to ride horses, like I used to ride horses, my sister was a fabulous horseback rider. I was not. I fell several times, but I love being barn crew. And I love to ride and trail ride, but horseback riding, that puts a lot of pressure on your pelvic floor. So again, I'm not worried about that CoQ10. I don't think that would bother your bladder. You won't really know until you try it, though, but I would be surprised if it did. Let me kind of come over here to YouTube. Hello, YouTube. Danielle says, so Danielle was talking about the ozone machine to help heal her pelvic floor. And she says her aunt goes to a very exclusive doctor. He said the only thing that heals pelvic congestion syndrome is to get rid of the inflammation with the ozone. Well, pelvic congestion syndrome is very different than pelvic floor dysfunction. So yes, if you have pelvic congestion syndrome, which is basically varicose veins in your pelvis, if there's a chance that the ozone might help with that, that makes sense. I'm not up on that research, so I can't tell you if that's valid or not. Lee says, I've been diagnosed with IC by a urologist 6 months ago, eliminated foods which helped heal the worst symptoms, but no real causation for flares. How do you get down to the real issue? Lee, great, fantastic question. The devil is in the details here. When we talk about phenotyping and trying to figure out what your group is, the way we do that is with your symptoms. And sometimes it's a little weird, funky symptoms that help us solve that issue. So I use the phenotyping system that was proposed by Dr. Christopher Payne 7-8 years ago. And he believed that there are at least 5 distinct patient groups, although now we have a new system from Canada with nine groups. But the Chris Payne system has served me very, very well. So let's go over those subtypes very, very quickly, and let's see if you resonate with any of those. In his system, IC subtype 1 is Hunner's lesions. So these are the patients who have big bloody wounds in the bladder. They're bleeding. Their pain levels are off the charts. They're down to eating 4 to 5 foods. They're peeing 20, 30, 40 times a day, maybe even more. Very difficult for Hunner's lesion patients to sleep, especially if the lesion is on the back side of the bladder. And as they sleep on their back, urine collects over the lesion and irritates the lesion. So if anybody's looked inside your bladder and told you you have lesions, not glomerations, not petechial hemorrhages, that has to be called a lesion or an ulcer. If they've done that, and listen, if your pain is off the charts, normally if your pain is off the charts and you've got really severe pain as your bladder fills with urine, they're going to want to take a look, and you want them to take a look. And they will do that with a cystoscopy, quick looky-loo in the bladder. Hopefully they've got what we call a narrowband imaging cystoscope, which is a very, very high detail scope that will allow them to see Hunner's lesions without doing a hydrodistension in the hospital. So, but if you're in severe pain, we normally want somebody to look to see why. Because there could be a bladder stone in there. There could be a number of things in the bladder, and it's important to let them take a look in the bladder if you've been in pain for a period of time. I have shared the story of one woman who was in pain for years. She was terrified to let them look in her bladder. When she finally did, they found this ginormous bladder stone that was basically cutting her bladder as it was floating in her urine. Once they broke up the bladder stone, she was healed, right? Okay. So Hunner's lesions. Our second subtype is bladder wall driven. So these are the patients who have pain as their bladder fills, gets better as they urinate, a lot of frequency, a lot of urgency, a lot of getting up at night. The first thing we're going to look for in this subtype is chemical irritation, because the bladder, like any other part of the body, can be injured, and generally it's injured through some sort of chemical exposure. So if your symptoms began after chemotherapy, if you're drinking a lot of coffee, a lot of green tea, a lot of Diet Coke, a lot of energy drinks, those are over time going to irritate the bladder wall, because you have to remember your bladder was designed for life thousands of years ago before we had such high acid foods. I come from Norway. My family is Norwegian and Swedish, 100%. And the only acid my ancestors had were berries that were unripe. That's it. And so it was seasonal, and it was only in the springtime. There were no oranges in Norway. And so maybe from an evolutionary standpoint, my bladder had not had the time to build more defenses than, say, somebody whose ancestry was around the equator, where there was a lot more fruit. But ultimately, in the end, what I'm trying to say is that today's acid load and today's chemical load far out exceeds no, that's not the right word. It defeats the defenses your bladder naturally has. If you pour acid on your bladder every day, eventually that bladder is gonna start reacting to it. And again, if you're Scandinavian, it's going to be earlier. But anyway, I'm sorry. Chemical irritation of the bladder, concept number one. The second thing we're going to look for in this group is in women with estrogen atrophy. Because aging or the loss of estrogen through birth control, Lupron for endometriosis, hysterectomy, that loss of estrogen directly affects the superficial integrity of the bladder wall. Because your bladder's wet on the inside. Your bladder is meant to be wet. There's a big, thick, jelly-like coating on your bladder wall. It's mucus. And the purpose of this mucus is to act as a barrier, protects everything. And unfortunately, it's estrogen dependent. So when you're young and you have a lot of estrogen, you got a lot of mucus. But if you're on birth control, if you've had a hysterectomy, you don't have the estrogen, therefore you don't have the mucus. That's your bladder's ability to defend itself is now compromised. That's not a bladder disease. That's just estrogen atrophy, which we now call the genitourinary syndrome of menopause. So if your symptoms began after the age of 40, we have to consider the quality and health of your skin. Because if your vulva is dry and your vagina is dry, then so is your urethra and so is your bladder. And that might be why that coffee you enjoyed in your 30s all of a sudden is irritating the heck out of you in your 40s, because you just don't have the nice thick coating in your bladder that you used to have. right? So estrogen atrophy is real. It's not a disease. The way we treat it is with topical estrogen. That's the most natural thing you can do. When you give that skin estrogen, it produces mucus. Let's go to our third subtype. Our third subtype is pelvic floor driven. And this is our biggest subtype by far. Like 85 to 90% of you have muscle problems underneath it all. And what so many of us never knew is that a muscle injury can directly affect the bladder and can directly cause frequency, urgency, pressure, pain. And that is why our new guidelines are very clear. Patients who are being considered for a diagnosis of IC at their first appointment at the urology clinic, they are supposed to have a pelvic floor assessment. And if the pelvic floor muscles are tight, they are to be immediately referred to a pelvic floor physical therapist. Because as long as those muscles are tight, that bladder is not going to be healthy. So how do you know if you have tight muscles? It's about how you urinate. When you go urinate, can you start your stream right away or do you hesitate? 5, 10, 15, 20 seconds. If you can't pee right away, you got tight muscles. You know that flare you have with sex? That's a muscle flare. You know that flare you have driving? That's a muscle flare. If you ever feel a vibration when sitting, if you ever feel a pulling sensation, a pushing sensation, sometimes tight pelvic floor muscles feel like there's something stuck in your vagina or your rectum. Like you feel like there's something there when there's not something there. And it's a sensation of a foreign object. And that's just a very, very tight, dysfunctional muscle. And so therapeutically, our priority for this group of patients, yes, you're having bladder symptoms. We completely understand you're having bladder symptoms, but bladder treatments are never going to fix us. That the bladder symptoms are the effect of the underlying cause, which is tight pelvic floor muscles, which have restricted blood flow to the bladder. So our therapeutic priority is to restore blood supply. And when we do that, the bladder finally gets the oxygen and the nutrition it needs to heal. And that is why I am now symptom-free after decades of issues. Bladder treatments never worked for me. Amitriptyline never worked for me. Hydroxyzine kind of felt good, didn't stop the flares. And I think you have to ask yourself too, is there room for improvement? Because some of you are like, hey man, don't tell me it's my muscles. I'm peeing all the time. I'm going to keep taking my bladder meds. And I talked with somebody who'd been using Elmeron for 27 years. And I asked him, I said, listen, are you better? He said, no. Why are you taking it? Why are you taking it? Have you heard about the eye issues? Yeah. Why are you taking it if it hasn't made you better? Have you considered anything else? And in fact, he could not urinate on command. And there were other symptoms. And when I asked him where his pain was, he goes, on the left side. Well, dude, that's not your bladder. The bladder is not on the left. The bladder is centered directly above your pubic bone and below your belly button, but it's low. He's got his hand 4 or 5 inches to the left. It's like, God, that's not your bladder at all. That's your muscles. So we sent him off to see if he could get a pelvic floor assessment. World War II vet. And also, hey, if you got my newsletter that we sent out, we did an article on military, toxic exposures in the military, because we know toxic compounds can cause a wide variety of issues, including bladder cancer, right? And so they've documented higher and higher levels of bladder cancer in some soldiers who have been exposed to burn pits. I just found out, by the way, that my ex that I hadn't talked to in 25 years, because he remarried living back east, right? And we didn't have children together. He died of cancer. He was a vet. I met him right when he came back from the Middle East. So he was a victim. And this wonderful veteran that I was talking to, he had confirmed Agent Orange exposure. So anyway, okay. But that said, he also had muscle issues. Okay, let's keep going. Let's go to IC subtype 4, pudendal neuralgia. So these are patients who have positional symptoms. You're fine when you stand, but when you sit down, it hurts, or when you bend over, it hurts, or when you lay down, it hurts. If moving your body position changes your symptoms for better or for worse, that is not your bladder. That is your pelvic floor compressing or pushing on nerves. Or I was working with one patient last week, who had a ginormous fibroid tumor, like a 10-centimeter fibroid. And when she laid down, that was pushing backwards against nerves and also against her bowel, right? So anytime symptoms are very, very positional in nature, we're always looking at that body position, and we're always looking at muscles and nerves, okay? And last but not least, we've got the widespread pain subtype. So these are the patients who have more than one pain condition. So you got the bladder pain, you got the vulva pain, you got rectal pain, you got TMJ, fibromyalgia, you name it, it's all in there, right? Vulvodynia, et cetera, et cetera. And this is my second subtype. And as somebody who lived that life in my 20s and 30s, it's just like, why is this happening? Why do I have different parts of my body developing painful syndromes? And now we know why. It is basically an injury to the central nervous system. And what our research shows us is for patients who have multiple pain conditions, we see the connection in how the central nervous system is functioning. Patients with widespread pain have very, very high anxiety disorder. I had severe anxiety in my 20s and early 30s. Severe. That is a sign that your nervous system is not behaving correctly, that you are in an extended state of fight or flight, that your brain at any given moment on any given day thinks your life is at stake. And so what that's doing is that sensitizing your nerves, and that's causing long-term chronic muscle tension and long-term chronic neuroinflammation. And so therapeutically for these patients, we're going to be doing things to get that central nervous system out of fight or flight. And when we do that, everything calms down and improves tremendously. So 5 core variants, okay? Now, another variant might be if you're just struggling with urethral pain. Another variant might be a chronic UTI, although that's a pretty small group, despite what some people say online that everybody has chronic embedded infection. Absolutely not true. But there is a small subset of ICUers who could certainly have a chronic infection. We have new research now that suggests that it is not an E. coli, it is not a pathogenic infection in the way you would think it would be. We have new research which shows that some IC patients have an overabundance of a lactobacillus that's quite harmful, called Lactobacillus minors, probably from the overuse of antibiotics. So we have lots and lots of subtypes. Now, if you ever want to try to go through these in depth, you're always welcome to call me here at the IC Network office. You can see our number, our 800 number. I would be always happy to talk with anybody by phone, no charge. If you want to talk a little bit, that's fine. If you want to spend a lot of time talking, I might ask you to sign up for a coaching session. But I would be more than happy to try to help you figure out what your subtype might be. Okay, so let me go back here. So, Lee, that was for you. Danielle, I agree with you about that commercial product. Danielle says, may I ask if a vaginal TENS be used for good pelvic floor? Because I do believe I have both symptoms. It could be, yes. It could be. There are also some wands, like here is the wand that we have on the IC Network shop called Soul Source. So you can use a wand like this internally, which is what I do when my muscles start to get tight. And it works beautifully. And they make some wands that actually vibrate a little bit to try to get those muscles to release on the inside. It's not sexual. Do not even think there's anything sexual about pelvic floor therapy. There's not. It's injury or trauma. We got to get these muscles to release. Danielle says, I'm unable to get to therapy, doctors between car issues and being able to get around, so I have to bring the machines to me. Okay. X1 says, when I have only pain when I sleep and when, okay, hold on a sec. X1 says, when I have only pain when sleeping and it keeps me wake up to pee, what does this mean other than no issues? Well, so that makes me think of two things. Uh, Often nighttime urination is a direct result of something that's irritated your bladder during the day. And the thing is that during our waking hours, we have a lot of distractions. So we don't necessarily feel a slightly irritated bladder. But once you turn the TV off and you're back in bed and you're trying to fall asleep, that's when you feel everything because you're not distracted anymore. So that literally could be from having a couple cups of coffee a day. And the other thing that I think might be interesting to explore is body position. What I would like for you to do is lay on your left side for 10 minutes, see if anything changes. Lay on your right side for 10 minutes, see if anything changes. Lay on your back for 10 minutes, seeing if anything changes. Pay attention to body position and if that's changing your pelvic floor. I say this because my left side pelvic floor is very tight because my left SI joint is very flexible and it shouldn't be moving and it is moving. So my left side piriformis muscles lock down tight to stabilize the joint. And I wasn't doing physical therapy. And I got to the point where for a couple of years, I could not lay in bed without getting this searing pain right in my SI joint. And I remember my cat would just be desperate to lay on me at night. And, I'd be like 10 minutes of just pure of her purring. And then, it'd start to hurt and I'd have to put her off the bed. And I felt so bad for her, my sweet little kitty. Lee says, hysterectomy, menopausal, cystoscope was clear. Mine usually is at the end of urination pain, urethra mainly, though the initial symptoms was the entire bladder feeling full all the time. All right, so Lee, you have to remember that the urethra is a canary in the coal mine when it comes to estrogen atrophy. So the urethra is often the first part of the urinary tract that will start screaming. That was me when I was 51. It felt like there was a drop of urine stuck in my urethra that would not come out, and it drove me freaking crazy. And listen, my IC skills are really good. I mean, obviously, I wrote the IC Network website, and we're rated #1 by Harvard Medical School. Okay, so I know my stuff. So I got this urethral pain. I threw everything I knew at it, nothing worked. And nothing. So I threw myself on the mercy of my urologist. So I'm laying there in the stirrups. He's looking at me going, chill. And I'm like, what? Looking at him through my knees. He goes, didn't you use the estrogen cream I prescribed for you last year? And I went, no. And he said, why? And I said, because in my brain, I'm 25 years old and I can't possibly have an age-related issue. And I still feel that way. And it's 10 years later. And that got him laughing, but that was very true. And he said, I saw this happening last year, Jill. That's why I suggested it for you. You have estrogen atrophy in your urethra. And he was right. And he gave me the topical estrogen. I rubbed a pea-sized drop into the entrance of my urethra. And 10 days later, all the urethral symptoms were gone. If I don't use my estrogen, it starts to come back. So I'm very invested in using a little bit of my estrogen cream at the entrance to my urethra. That's not a disease. That's just estrogen atrophy. All right, let me come back here to Facebook now. Peggy says to Marlia, any statin that causes muscle and joint pain means you are having a reaction to it and you should change meds. You need to talk to your doctor about that. Thank you, Peggy. Hi, Paula. David says you don't. It's on the website. David says she doesn't see Sister Reno on the IC Network website. Go up to supplements. Go up to the menu that says at the top of the shop that says supplements, and you'll find it there. I don't have it on the front page of the IC Network shop because it's not very popular. Cheryl says, I do love that you send me my supplements automatically every month. This is a great way to get them. And they're discounted 10%. Annie says, I want to know if an estrogen deficiency is possible at 33 years old. Absolutely it is, especially if you're on birth control. In fact, I was listening to a podcast a couple days ago, and they were talking about the age of onset, and that literally there are some women who are in complete estrogen atrophy at the age of 35. It's all about kind of genetics and your what happened with your parents and stuff. So it's very possible that you could have estrogen atrophy at 33 years old, even from early perimenopause. Yvonne says, how do you know if you have estrogen atrophy? What are the symptoms? The dominant symptom of estrogen atrophy, and I think one of the earliest symptoms of estrogen atrophy, is something that I call urine burn, where your urine starts to feel very hot, like it's burning you as you're urinating. And it's not burning you. It just means that your skin is dry. The skin on your urethra, the skin on your vulva is dry. So if you've got urine burn, pain on the outside as you're urinating, or any pain on the outside of your body, on your vulva, if you're a woman, we're always going to be considering estrogen atrophy. Otherwise, kind of the urethral symptoms, and if that estrogen atrophy has progressed up into the bladder, then you're going to have frequency, urgency, pressure, pain, because your bladder is dry and can't protect itself. Cece says, does anyone else feel like any type of birth control affects your IC, your whole body, your emotions? Definitely. And I have to tell you, you know what? Let me find it here. I belong to several physician discussion groups online that you would never be able to get into, but because I'm a professional doing what I can do, I have professional privileges. And there was a very interesting, let me find it. Let me find it. I thought it's not on this computer. Hold on. Hold on. Let me. Yeah, there's the email. So, okay, who was asking for help with a patient who had migraines associated with her period. Now, we used to call in the old days, I see a pelvic migraine. Because there seemed to be, I mean, we now know that migraines are related with the widespread pain conditions, but there seem to be a few more correlations that I think have been disproven, but the whole concept of IC as a pelvic migraine is a very old, very interesting. So anyway, we have a doctor who is asking for help with a patient who gets migraines associated with a period. And Dr. Robert Eckenberg, who is our best pelvic pain doctor in the country, said here, and I'm going to read you his response. Cyclic neuropathic pain is not uncommon. That neurogenic inflammation is influenced or enhanced by estrogen in many individuals. And he notes that vestibular sensitivity, the vestibule is the entrance to the vagina. Vestibular sensitivity is commonly increased with topical estrogens in premenopausal women, in my experience. So somebody is premenopausal, or they have estrogen. They already have estrogen, so giving them a topical estrogen might give them a little bit too much. And then he has some suggestions here on what to do. So he suggests progestin for a few months and also using a lidocaine cream to slowly desensitize the fascial network of sensory end-plates under the skin anywhere in the body, especially in the vestibule for provoked vestibulodynia. Um, uh, Twice a day for a month, and then to use as needed when she gets sensitivity. Now, in the IC patient population, we know that it's very common for, looks like we lost our YouTube chat. Very common for female ICers to flare the day that they ovulate. I used to flare. It was like a 6 or 8 hours moderate flare and a couple of days before their period. And his explanation helps us understand why that happens. That when estrogen levels are high, that it enhances neurogenic inflammation. Anyway, I sent him an email. I said, we need to do an article on this, and he's going to call me back. Why, hello, Kayleen. How are you doing, hon? Kayleen says, any birth control that causes a period makes me so miserable. Everything burns and gets really tight. So there you go, Kayleen. Renee says, I'm 68 now, but yes, birth control affected me. I will say my skin never looked better. I had no problem with the pills. Okay. Renee says, me, use the cream. I would take my period back for life. Thank you, Deborah. Gay says, I now have an axonic sacral neuromodulator implant. I've had it since October of 2022. Good to hear, Gay. It's going well for you? Not having any issues, I hope? That's a challenge with these implants, is they require constant monitoring. Constant monitoring. Now, you guys on YouTube, I don't know what's happening on YouTube. It says the chat disconnected. Please wait while we try to reconnect you. And then they say unable to connect chat. Please try again later. So for those of you watching on YouTube, honey, I'm sorry if you can't put a question. You can always email me your questions, icnetwork@mac.com, or you can come on over to Facebook into the IC Network channel on Facebook and post your questions here, okay? So I'm a little confused. Can somebody here on Facebook go over to our YouTube channel and tell me if it's shut down? Here, hold on a sec. Let me hold on. Let me just see. Oh, I hate doing this because it's going to mess with the quality of the stream. Give me just like 5 seconds and just see if I can connect. Or let's see if it's shut down, because if it is, I'll restart YouTube. All right, you guys, for those of you on Facebook, bear with me just a moment, okay? Hold on. No, it says it's live. Okay. All righty, it's a little bit low. Okay. All right, so for you YouTube guys, hello technology. You can pop me an email, icnetwork@mac.com, or you can come on over to Facebook, okay? And hopefully it'll reconnect. William says, let's see here, hold on a sec. Eddie says, are the exercises for pelvic floor and IC one and the same? There are no exercises for the bladder. The exercises are only for the pelvic floor. I mean, there are bladder training, but we're not talking about that. And ultimately, in the end, you can't just start any stretches and stuff that you see online. You have to go to a physical therapist at least once so that they can figure out, is it your left side? Is it right side? Is it shallow muscles? Is it deep muscles? You'll never figure it out on your own. We need a professional to touch your muscles at least once to at least tell us where you're supposed to be working. And then after your pelvic floor assessment, especially if you can't afford continued therapy, that's okay. If you can walk out of that first appointment knowing that, hey, I've got a tight piriformis muscle, you can then come to the IC Network. We have a whole thing of free, we have a free download of pelvic floor relaxation exercises that you can do on our free downloads page on the IC Network. For members, it's right there on your member page, at least it should be. So I think well, let's see, is it? It's definitely in our free downloads area of the IC Network website. So go to icnetwork.org, go to that interstitial cystitis pull down menu, very bottom link is free downloads. Go there. You can print out the 10 exercises that should help. Danielle says, do we sell this wand? Yes, we sell the wand. She goes, are there instructions? There are basic maintenance instructions, but it's a physical therapist that has to tell you how to use your wand based upon which muscle is messed up. Okay. William says, hello, Jill. My Hunners opened up last night. Damn it. Blood clots came out. Had your fulguration 3 months ago. Wish I could have had the hyperbaric oxygen therapy. So now I'm back to dealing with the clot. Damn it, William. I'm so sorry. Maybe be the squeaky wheel on the hyperbaric oxygen. That's one of the other treatments for lesions that I didn't mention. It's hyperbaric oxygen therapy, which kind of pushes high levels of oxygen into your bloodstream when you're in a hyperbaric chamber. It's also been found to be quite helpful for lesions. So, William, hon, you got to lock back down on that diet. Protect your bladder as much as you can. Call your doctor in the morning. Depending upon how many clots you've got going on there, the doctor may want to see you. They might want to do a urine culture just to make sure you didn't pick up a UTI, and maybe your lesions are fine. Maybe you've got a UTI. So I would be making a phone call to your doctor tomorrow morning for sure. Let them know you're bleeding. Get your urine tested, and let's just do that preliminary workup. Okay, hun? You got to do it, hun. You just got to do it. Listen, guys, one of the other articles in our magazine is blood in your urine. Is it something you need to worry about? And visible blood in your urine is something that you need to be aggressive about. You should not be seeing blood in your urine. You should not be seeing blood clots in your urine. You should not be peeing pink. You should not be peeing red. Even if your urine is brown, that means that something is not right. And it is important that you let your doctor know so that they can do a proper workup. It could be an infection that you just missed. You might think you have a flare. Maybe it's actually an infection. Infections can bleed. But it can also be a kidney stone. If you have a kidney stone that's scratching your ureter, scratching your bladder or your kidney, that could be bleeding. Or it could be an early sign of cancer. And so you never, ever just assume visible blood in your urine is healthy. It's not. There's something going on. And we had a patient call 2 weeks ago who every week for 2 or 3 days, she was peeing bright red blood. And what was amazing is that the doctors looked at her bladder. There was nothing in her bladder that was bleeding. And they kind of like, well, we don't know. And she's anemic now. She's bleeding so much, she's anemic. And I said to her, well, honey, the blood's got to be coming from somewhere. And the assumption is it's coming from her kidneys. And she needed to be a lot more aggressive with her doctor about checking that out, in my opinion. At least I would have been. Peggy says, can you have more than one subtype? Yes. Renee said, finally got in with a pelvic floor therapist. She showed me what is going on. So you're a gynecologist. You prescribed an estrogen cream. Yeah, baby. Yes. And you're going to start some bladder installations, maybe a low dose Caflex. I've had several bladder infections lately. Also have ulcerative colitis, TMJ, fibromyalgia. Okay, so Renee, you got a couple of, you got different things going on. You got to work on the muscles for sure. You got to work on the health of your skin for sure. We got to figure out what's going on with your bowel. If you're using Elmeron or you used Elmeron, that could be Elmeron could be the cause of that. And we now have a new very strong association between Elmeron and ulcerative colitis, irritable bowel, and inflammatory bowel disease. And we have an article on that also on our website. And in the many papers, well, many, I'm going to say a handful of papers that have been published, generally stopping the Elmeron healed the bowel. So if you're taking Elmeron, that could be what's going on with your ulcerative colitis, maybe. And the whole TMJ, fibromyalgia, that means that we've got to work on your central nervous system and we got to work on your muscles as a whole. I've had very bad TMJ for the last, well, I got rear-ended really badly in my 20s. That's when it started. And then it was mellow for a while. And then it kicked in 6 months into COVID. And now I have to push my jaw back into place every morning. I can't sleep in a bed. I sleep in a recliner because of it. I finally have an interview or an appointment with a TMJ specialist 40 miles away in August. And I've been doing a lot of reading on it, and I need to do a lot more reading on it. Ultimately, it comes down to the neck, trigger points in the neck, trigger points and muscle tension. And ever since I got rear-ended, I've had a trigger point right here. It's never gone away. Sometimes it gets bigger, but it's like the size of an almond. Life, right? So you got to calm your nervous system down, but we got to get those muscles healthy. So Renee, there's not going to be one thing that's going to make all this go away. You got multiple things going on, just like me. Don't feel overwhelmed. Just little steps every day. We're just going to work on trying to improve everything, but little steps, not big steps. Peggy's asking about my use of the term variant. Variant is inside each subtype, there are variations. So in the bladder wall subtype, there's a chemical injury, there's the estrogen atrophy, and the chronic UTI. Renee says, I've been able to get widespread pain down with a multifaceted program. Awesome. David said, there is no Sister Renew on the IC website. Well, hold on. Maybe we're out. Let me look. Oh, it's right here, hon. 2 clicks and I was there. I'll give you the link. There's the link for it. Annie says, I'm not on birth control, but the month my bladder pain started, I was 7 months without any periods. Girl, if it walks like a duck and talks like a duck, it's a duck. If you didn't have a period for 7 months, welcome. Welcome to the elder years. You know, it's rather infuriating that there's an assumption that when a woman stops having a period, she's lost her value to society. Well, screw them. We're smarter than ever now. This is like a battle cry, or you know, I'm quite happy to not have painful periods. I just wish I didn't have the wrinkles. Danielle says, I came over now. I know how to find you on Facebook. Anyway, to sell the wands on your website for pelvic floor. Yeah, they're on our website. Let me get you the link. The link, the category is physical therapy supplies. And there you go. Here is the link for that right there. Renee says, can physical therapy help with TMJ? Honey, I've been in physical therapy. I was in physical therapy for my TMJ for almost 2 years. We stopped in January. And the reason why we stopped is he's like, Jill, you're tight. And we're just trying to figure out why I'm so tight. I'm tight on my right side from the waist up. I'm tight on my left side from the waist down, which happens to coincide with the fact that I have a scoliosis and an S curve. And with physical therapy, we were able to, my mouth used to open at an angle. So now it's everything matches, but we haven't been able to stop my jaw from dislocating. And that's from the muscles are so tight here that it's pushing down like this, which is forcing this side open. So now my ligaments are stretched out on this side. So I have ligament laxity. They probably won't. I just need, before COVID, I used to get neck massages all the time. I had a really good friend who came over twice a month, really affordable. And I got neck massages for years for this neck thing. I haven't had a neck massage in 3.5 years. And the TMJ is just, oh. Renee says, okay, my oldest daughter has scoliosis. She's taller like you. Yeah, scoliosis. I always say if there's one thing I could change about my body, it'd be the scoliosis. I get a lot of back pain right now. I don't know. I mean, if I bend the wrong way, I get pain right in between my shoulder blades and my muscles, both sides. So like yesterday, I was wearing 2 heating pads, one on the left, right between my shoulder blades. I need my massages back. She retired. She was perfect. She was so good. Her name was Julie. Oh my God. I will call her anyway, see if she's around or if she can recommend anybody, because I got to get these muscles healthy. I want to sleep on a bed. I just want to sleep on a bed. I can sleep on my couch for about 4 hours, only on my right side. If I try to sleep on my left side, my jaw dislocates or starts to. Renee says, you lucky girls, you're tall. I'm supposed to be about an inch taller. I should be 5'10". I'm 5'9". That's the curve. All right, let me check my email. So for you guys on YouTube, again, your chat shut down. I don't know why, and it's not coming back. And I don't know how to fix that. No emails. So for anybody on YouTube, if you have a question. Now, the other thing that I would be happy to do is if anybody wants to come into Zoom so that you can talk to me, we can have a discussion where people can hear you and you can see others. We can start up the Zoom. I'm happy to do that. Danielle says she was on YouTube. I have an error message here. So the last comment I saw on YouTube was from William about his Hunters opening up. After that, it says the chat's disconnected. So I got nothing after that on YouTube. I'm sorry, guys. I think, so many times when people call me, they're shocked to talk to somebody else who's had this. And I'm very struck by the silent suffering of patients with bladder stuff and bowel stuff, and how incredibly wonderful it is to be able to just hang out with somebody who's like, oh man, you had the black beet soup, it killed you, right? Oh my God, me too. It's just so comforting to be able to talk with others who have like walked that walk and talked that talk. Because there are just weird things that leave us baffled until we talk to somebody else, or something simple like, okay, how do you make sex more comfortable? I want to have sex with my partner, but my pelvic floor gets funky. What can I do about that? Okay. And what some patients would say is you could use a wand beforehand just to try to get your muscles a little bit relaxed and released. You could even use a skeletal muscle relaxant. That will calm things down a little bit, right? And so you don't have to recreate the wheel here. There's a lot of expertise in the room. There's a lot of expertise in the IC community of things that we've all, over the years, have learned that we absolutely want to pass on, because ultimately, in the end, it's our job to make it better for the next generation. I mean, who's going to sit in my chair when I retire in 10 years? Although I was working with a lady yesterday who's still joyfully working at 76, and I hope I can be joyfully working at 76. But we need to get more people involved. So again, coming back to this concept of IC Awareness Month, what do you think IC Awareness Month should be about this year? Is there anything timely happening right now that we can, because getting the media to do a story on the bladder, on IC, let me tell you, I've tried everything. We've tried everything. And our press coverage for IC is really hard to get. Editors are not interested in the IC network or the ICA. They want to know how lives have been changed. We need patients to speak out. So if I do a story about, hey, I'm the 30-year IC support group leader, longest serving support group leader in the world, yeah, that's not going to go anywhere. They want to know how a life has changed. And so your stories are the stories which really drive IC Awareness Month, which is why it's so important that you speak out. Sue says, I feel like my whole life, if I talk about my bladder pain around family and friends, they just want to avoid me. So you live in painful silence in order to not be judged or dismissed or get the eye rolls. Sue, I can totally relate to that. And I was thinking about that this morning, because as I think about my life, I grieve the lost opportunities. That when all of my friends that were out getting married and having babies in their 20s, I was laying in fetal position in the bathroom right there for years. Terrible IBS. And, out of Sue, it's like a combination of self-preservation with absolute total frustration and anger at people who are judgmental. And I'm living in my home, my parents' home, which is now my home. And I love this home. This is my safe place. But I'm very honest, it's also been a prison. It has felt like a prison to me. And it felt like a prison in my 20s when I was just too ill to go do anything. And not being able to go to wedding showers and baby showers and weddings and lunches and movies, and your friends just trickle away. They just trickle away. So all the friends I had in my early 20s, all my tennis buddies that I played tennis with for years, and we were a very successful ranked tennis team. I was number 6 in California, singles. All those friends drifted away, all gone. There's one that occasionally talks to me, and she's just like, I never get, Jill, I'm sorry. I never understood you, right? So you have to come, but I mean, I wish it had never happened to me. Oh my God, I wish you were never, ever going through this. But I will tell you that it's like being thrown into a kiln. You get sharper, you get stronger for the experience. I mean, I think that if I hadn't gone through that, number one, if I hadn't gone through any of that, I would not have been able to be the support group leader that I've been. And I love this job. And having gone through that experience helps me understand intimately what you're going through, because believe me, I've been there. But there's like this underlying grief. I was really thinking this morning, because I can now dream, right? I'm no longer obsessed with caring for my parents. I get to think about, what do I want to do? And I want to tell the stories of those of us who faced childhood and young adult disability, who society glances at. They don't take us seriously. They don't. I mean, they do now, because believe me, I will get in the face of anybody who has the audacity to try to disrespect me or anybody else. But, back then, you just become the hidden ones. That'd be a great book. That'd be a great book title, The Hidden Ones. And Sue, I would love to tell your story. We can't hide anymore. We cannot hide anymore. That will never get us where we need to be. And when I think about those children today, right now, that child who has a pelvic injury, may have been hit by a car, whatever, who is in junior high, high school, starting to have to urinate all the time, is slowly pulling back from their life, pulling back from their friends at school. Man, we got to help them early. And that's like the best part of my job, is finding somebody in their teens and 20s who is exactly where I was, and being able to say to them, this is not your fault. You have done nothing wrong. No shame, no blame. I want to say to them what I needed somebody to say to me that I never got. And that is, you didn't do anything wrong. Because when you're in the middle of it, and the pain is so crazy, you're just grasping at straws. Like, why me? Why now? Why has this happened? Apparently, I'm a flawed individual who deserves to be punished, which is exactly how I felt in my 20s. I felt like I was being punished. What for? I don't know. Existing. And I know now it was never about me being punished. It's not about you being punished. We just got hurt. That's all. Or our estrogen levels have changed. And I just think it's so important that we speak our truth, speak our story, take the shame away, take the blame away. This happens. If you have broken your tailbone in your teens, you may have urinary symptoms. Maybe that's what we need to do. Tailbone injuries for IC Awareness Month. You guys, we got to come up with something in the next 2 weeks because I got to write the press release by September 1st and change the website. So give me some ideas. Sue says, I need to tell my story since certain things I've developed in the last months. I feel like I'm living in a prison and can barely leave my house, but right now I have to wait. Yeah, and that's the other thing is we do have to wait for healing to happen. I mean, I was very close to home from like 24 to 50, 52. And then I started the pelvic floor work in my early 50s, and that's when things slowly got better. And Sue, your story is an incredible story anyway. And that's true for all of you watching this. And that, kind of like that's like another thing that's really come to me with the passing of my parents and, to be crying just randomly. Like literally, I walked into their bathroom 2 nights ago because there was a mosquito in my bathroom. And I'm like, I'm shutting the door. I go into the bathroom, take a shower. I see my mother's shower cap and I start bawling. I loved washing my mother's hair, but it's just like reminding me that we all have such powerful stories and you just never know who you see walking down the street in the store, what they've gone through. And it's just this whole new level that I had been protected from for so long. Danielle says, I'm going to be 50 years of age. I've been stuck in my house for 5 years and in a relationship with somebody 10 years younger, which has been so hard on him. Not to mention I have autism spectrum on top of this nightmare on one step at a time. Okay, so Danielle, number one, totally get it. Number two, not your fault. No shame, no blame. I want you to look yourself in the mirror with pride. Look at what you've gone through, and you're here, and you're fighting, and you're trying to get better. But the fact that you're not improving means that we have missed something. And and you are truly an anatomical mystery to be solved. So we have to make sure, I mean, if there's room for improvement with your respect to your symptoms, in other words, the treatments you're doing are not keeping you out of flares, you're still struggling, man, let's take a step back and revisit the diagnosis and ask ourselves, what could we have missed here? Like pelvic floor muscles, et cetera, et cetera. And honey, I'm happy. Anytime you'd like to call, I would be happy to talk with you. No worries. Michelle says, in 1984, I was told I have no infection from my general practitioner and that was all in my head. Yeah, that's what we were told. I was first diagnosed in 1973 or 4 when I was 13 or 14 years old. And if they didn't find infection, the assumption was that it was all in your head or you would outgrow it with maturity. Although Vicki Ratner, who founded one of the ICA, she founded the East Coast ICA, she was in med school at the time when she developed her symptoms. And she had a doctor tell her to have more sex. Like, screw you, dude. No, sorry, I'm not going to screw you to get better. She didn't say that. That's my personal reaction. This is the blessing here, Michelle, is that we've learned a lot in the last 40 years. And that was 40 years ago. And we have so much more hope now. Now we have a really good, rigorous diagnostic workup. We have a much better idea of the many different things that can cause pelvic pain, cause bladder pain, and we're getting much better. Renee says, it's very prevalent. I can testify in the tailbone injury, 7th grade agony. I know, girl, that's like exactly what mine was. I broke my tailbone in half. I could move it with my finger. Danielle says, I've been trapped in the house for 5 years. It's like a death sentence. It's not a death sentence, honey. And listen, girl to girl, right now, girl to girl, or woman to woman, IC patient to IC patient. You got to get up every day. You got to put your clothes up on it. You got to put your clothes on every day. You got to put your makeup on if you can every day, and open that front door and walk. I don't care if you just walk to the end of your mailbox. Walk. Start moving. The human body is wired to move. We are the healthiest when we are moving. When you move, you produce natural endorphins. When you stop moving, that's when bad things start to happen, like muscles start to get weak. And emotionally, you don't have the endorphins. Your pain levels are going to be intensified. It's so incredibly important that we create a daily system of success. And for me, I'll tell you, I walk every day now, unless it's too hot. I mean, like I walked. I didn't walk yesterday; it was too hot. But I walked this morning. I try to walk at least 5 days a week, and I am so much better for it from just a overall health and sanity standpoint too. I bring my phone. I take pictures of flowers along the way. I just get out of my brain and just go be physical a little bit. And for many times, I just walked up and down my street for years. I live, I mean, like 6 houses that way, 6 houses that way, back and forth, back and forth, back and forth. Until I got strong enough to go down the big hill. And now I go up and down a lot of big hills. But ultimately, in the end, it's about moving. So start slow, baby steps. The second thing that I think is really important, and I have worked with many, many patients over the years, is self-care. I'm thinking of one patient who's a dear friend who went through a period of time where she was in so much pain she could not bathe. She could not get in the shower. And that really was heartbreaking for me as her friend, because she was across the country. I would have driven there and helped her get into the shower if I could have. I know that I feel better when I shower every day, sometimes twice a day if it's super hot. And I know that if I've got something hard to do, I always wash my hair and I always put my makeup on. Always. That when I am prepared when I've got my armor on, for lack of a better term, it gets me moving. And then the other thing that's just huge for me is I'm very attentive to my negative self-talk, and I counteract any negativity with positivity. I can do all things through my faith, which strengthens me. Every day, in every way, my life is getting better and better. That which is done for you, let it be done. That which you must do for yourself, do it. My favorite one is be bold, and mighty forces shall come to thy aid. If you've been at home for 5 years and you're not better, be bold. Ask for help. Get a second opinion. Call another doctor. And for all we know, one of the absolute national specialists could be within an hour of you. And if that's the case, let's go get a better diagnostic workup. Because Danielle, as an example, let me share one of the true IC stories of a patient who came to one of these meetings. I went through that. So this is a patient bedbound for 10 years, basically stuck in her bed for 10 years. Pain was so severe. And what do I always say? You are an anatomical mystery to be solved. So she listens to the subtypes, and she really resonates with pudendal neuralgia. Terrible pain when sitting, got better when standing, right? Her pain was very movement driven. So I explained pudendal neuralgia. She then started reading about pudendal neuralgia. She goes, man, this is me. I think I have pudendal neuralgia. So she takes the article, she takes the info to her urologist, says, I think I have pudendal neuralgia. Do you think I have pudendal neuralgia? The urologist said, absolutely. I completely agree with you. I think you have pudendal neuralgia too. One of the signs of pudendal neuralgia means that the pudendal nerve is being pushed on by tight muscles and body position. If you bend over, think of sciatica. If you ever had sciatica, pain that shoots down your leg when you move in a certain way, same concept, right? It's a nerve that's being compressed. So anyway, so the urologist now believes she's got pudendal neuralgia. So then she had some imaging done. And what did they find? Her tailbone had been badly broken and was sticking to the side. Let me get my model. Here, hold on a sec. Okay. So let me introduce you to your pelvis. Hip bone, hip bone. The way the human body is organized is the bigger the bone, the more weight it's meant to carry, right? So the biggest bones in the human body are your hip bones because they carry the weight of your torso, right? And here's the front, here's the pubic bone. I want you to see these are mirrored sides. You got a left hip bone, you got a right hip bone, and they're connected here at the pubic bone. Here, hold on, let me get a drink. Okay, now let's look at the pelvis from the back side. Vertebrae from your spinal cord. Here's your sacrum. Your sacrum is basically a triangular bone with 8 holes in it. And so the spine comes down here and then sends nerves through each one of the holes, which when you look at it from this side, the holes will come through there and will come through the pelvic cavity and down both legs, okay? So there's your sacrum. Hello, tailbone. Look at that little pretty thing right there. Wouldn't it be nice if we could wag our tailbone? Okay. The first thing I want you to notice about the tailbone is everything that attaches to it. It is the literal center of the attachments in your pelvis, right? And we've got muscles that go this way, and we've got muscles that they go this way. I also want you to note that it curves under. You see that? It doesn't curve out. It naturally curves under. So think about just a happy-go-lucky dog, right? You know, you're taking your dog for a walk. Dog's tailbone is hanging down. The tip of the tailbone is through his rear legs. It's just curving under. That's normal. That's happy. That's healthy. That's how it's supposed to be. But in the case of this patient, her tailbone was skewed to one side, right? And instead of curving under, it was curving out. You see that? So her tailbone was like that. So think about what that would do to the pelvic musculature. So all the nerves on this side now are stretched out. All the muscles and everything on this side is now massively stretched out, and they're not curved under, so everything is curved and strained outwards, right? And then this side over here, the muscles are going to be a bit more compressed. So it's like they see this massively damaged and completely out of position tailbone. Well, listen, she is a tough cookie. She's like, all right, what are we going to do to get this correct? That was why she was completely bedbound and had all these urinary symptoms. Took her a year. She worked with a physical therapist and she worked with a chiropractor every week. A year later, her tailbone was in the proper position. The last time I talked to her, like more than 95% of her pain was gone. And she said if she ever had pain, she knew her tailbone had slipped, she just went right back to the physical therapist. She was now working again, walking again, happy again, and she was able to have a baby. So to go in less than a year from a diagnosis of an incurable bladder disease that had left her bedbound for 10 years to finding out it was never her bladder, it was a freaking tailbone that they were able to fix, and she got her life back. And that's the part that really breaks my heart, is that I know so many of you have been told you have an incurable bladder disease when you don't, that you have injury or trauma. And the damage that's done when you're told you have an incurable bladder disease is devastating for your emotional health. But it's so much easier if you go, oh yeah, man, I fell down the stairs. Yeah, I broke my tailbone. Oh, this is related to that. Oh, makes total sense, right? All right. Thank you, Paula. Paula says, love you for what you do. Thank you, honey. Annie says, sexual life is one of the worst things to deal with. Do you have a cream or a lube to recommend? I'm a KY girl. KY works fine for me. The lubes are about finding, kind of what works for you. I used to sell a lot of that on the IC network, but you can get so much of it now just at your local grocery store. It's just kind of like, what's the point? Who wants to pay shipping when you can walk into your store and get it? Slippery stuff is very popular. Um, and for sex, it's important to have an after sex routine, right? And so, generally, in the typical IC patient, pelvic floor patient, the act of sex itself is usually okay. Intercourse is usually okay, unless you're a guy. If you're a guy and you have a pelvic injury, the worst moment is when you ejaculate, because that's a very strong muscle spasm on injured muscles. And then once that's over, things get better. And so for guys, if you have pain at the tip of your penis with sex, you need to go to physical therapy. For women, we're not quite that same. Normally for us, the act of sex itself is usually okay as long as you're well lubed. The flare doesn't start for about 6 or 8 hours afterwards, and that's because your muscles gently go into a spasm, contractions for about 12 hours after sex. And I think that that's about helping sperm meet egg. And so it's very common for women with pelvic floor dysfunction to flare 5, 6, 7 hours afterwards. And so you got to have your aftercare routine. You could ask for some vaginal Valium suppositories, put a little muscle relaxant up in your vagina, or you could take an oral skeletal muscle relaxant like baclofen or Flexeril or Valium to just get the muscles to chill down. Because if there's one thing we've all learned is that sex flares are short-term flares. They're nothing to freak out about. They're just annoying as hell. For God's sake, I want to have sex that's comfortable, right? And until we can get those muscles healthy and get those nerves calmed down, you got to do what you got to do. And that means you got to have a plan for afterwards. The other thing that I will say that I say this a couple of times a year. Remember, I have no shame here. I will talk about anything. I lost trust in my body when I was diagnosed. I was in a great relationship with a nice young man. We were both, I was a good relationship. But the pain was so severe that I was like, do not touch me. No. You can kiss me. That's it. And I remember when it was in July of 1993, I went to see Marshall Stoller, and I said to him, I said, I'm terrified of sex right now. What should I do? And he said, I don't want you to have sex for a year. Honey, you're really hurt. You got to just take a step back. And that was really, that was like, I can do that. I can do that. That gave me a lot of, okay, I had a doctor say I can't do this right now, so I'm just going to take a break. And of course, Todd and I broke up, and that was it. That was it. End of story there. But I had to build trust again. I could not let that fear stop me. And the way you build trust with your body is not with somebody else. It's not, you cannot expect your partner to figure out what works and what doesn't work. You have to figure out yourself. You know what that means? The big M. That it's very important that you prove to yourself that you can have an orgasm and it won't hurt. And that's what I did. And it's like, okay, even after my hysterectomy, it's crazy. It's like, okay, I'm going to see if this is going to hurt or not. And then when you realize that it's not terrible, then you can communicate to your partner that you don't have to be as afraid, and you will know what will feel good and will not feel good. But it's very, very unfair that you expect your partner to figure it out for you. That's all I'm going to say. Yvonne says, is burning in your vaginal area and bladder normal when you start low-dose estrogen cream? Absolutely. It's very common to have burning when you start using estrogen cream. The cream is not burning you. That means your skin is dry, and the burn should go away. The burn will go away with time. And again, for those of you guys on YouTube, I have an error message here. I know that you can hear me. I can't see anything that you're typing if you're typing anything. I've got an error message here, unable to connect to chat. So if you're trying to ask a question, I'm not ignoring you. I'm so sorry. You can email me your question, icnetwork@mac.com. That's M as in Mary, A as in Apple, C as in Charlie.com. Okay, it's just technology. You gotta love it, and then you gotta hate it. So Yvonne, that burning in your vaginal area, nothing to be afraid of. It should go away in a week or two. You gotta push through it. Don't do it. So many women, they start their estrogen cream and it burns the first night, and they're like, I'm not doing that again. They don't understand that you're super dry. And if you don't do it again, when you try it again a year later, you're going to be even drier and it's going to burn even more. You got to power through the first week, because every time you put estrogen on that skin gets stronger and healthier. So for me, the first day it probably burned an hour. The second time it probably burned for 10 minutes, 15 minutes. A week later, it was like a little puff of air and it was fine. They've watched skin. They've watched what happens under an electron microscope, how these cells respond to estrogen, and it's only good. They plump up. They start producing mucus with estrogen. The only thing that we would qualify is that some patients are sensitive to the base. And mass market creams like Premarin often have alcohol in them as a preservative. That can cause some extra burning. So many of us prefer to use a compounded preservative-free estrogen cream to avoid some of that extra burning. But the burning should go away even with the compounded estrogen cream within 2 weeks. And they should have told you that, so it wouldn't freak you out. Danielle said, it's so incredibly right. And knowing that my leg muscles had become so weak, walking has become difficult, for which being in martial arts for years is embarrassing to me, because the depression of this disease has gotten the best of me. But I'm going to fight my tail. Girl, come on now. You were a mixed martial artist. You got this. You've got this. And the thing, I mean, like I was a professional tennis player, and I was a gym rat. Back in, I mean, let me tell you, I was fit. I was a fit woman, and especially with COVID, I just started gaining weight, and I've lost some of my muscle tone because I wasn't going to the gym, and now I can go back to the gym if I want. I was shocked at how my fitness was affected by staying home with COVID. My blood pressure went up. I gained weight. Now I've lost all that weight, and my blood pressure is down, and I'm so much happier for it. I'm so much happier for it. Gay says, if you don't walk, you will get to where you can't move at all. Yeah, there was a lady at my store I was at yesterday who was very, very, very obese, and she could barely walk. And I really felt sorry for her because she was young. There's a lot going on. Danielle says, I get an ache between the middle of my vagina and the rectum. It goes from adult egg to a pain where I just can't sit or stand. So this is your levator ani, right? So if we put this here, right? So these are the shallowest muscles. So what you're describing is perineal pain. So here's the vagina, here's the rectum. And I know for me in my, when I was in high school and my vulvodynia was so bad, it was always concentrated right here. And it was like somebody had scratched all the skin off with sandpaper, rubbed the skin off with sandpaper. And it was always right in my perineum. What I didn't know, and what my favorite book, Breaking Through Chronic Pelvic Pain, taught me is that immediately above the skin of the perineum is something called the perineal body. You see that little spot right there? And you see everything that's attaching to it? Yeah, that's an attachment point for 4 muscles right there. And this model, unfortunately, you can't see it. You can see there's a little attachment point right here. And that little sucker is a hot spot. And so that's often why perineal pain occurs. So Danielle, make sure you tell the physical therapist about that pain. Michelle says, is it possible for men to have a tight pelvic floor? My son seems to pee more. Very, very common. Absolutely. The vast majority of men with frequency urgency prostatitis are muscle patients, for sure. And in my office, when we work with a man who's been diagnosed with interstitial cystitis, in 90 to 95% of them, we can find pelvic trauma. Very, very common in men. If he was a bike rider, a football player, if he was in the military, motorcycle rider, if he suffered any accidents, any falls, and think about boys, come on, they fall all the time. And so, Michelle, you say he was an athlete all the way through school. I'm wondering if he had an injury, and can men have tight? Absolutely. And there was a paper a couple years ago of men diagnosed with chronic prostatitis, and 70% of them had an underlying orthopedic issue. And they required referral to an orthopedic surgeon, like for a bad hip or something. What was his sports, hon? What were his sports? And you know what? I need to go blow my nose. I'll be right back. Give me a quick moment. Anybody who needs to pee, go right now. I'll be right back. 10 seconds. All righty then. Sorry about that. My allergies are always the worst at the end of July and August. Always. Ragweed, I think. I think that's what they say. It's ragweed. All right. So again, Michelle, whoops. What were his sports? That's what I want to know. How are you guys feeling today on a scale of 1 to 10? 0 being no pain, 10 being severe pain. Where's your pain right now? Sue says, I like organic cold pressed coconut oil for when I use a wand or have sex. Yeah, excellent. And I like the idea of the organic cold press. That's great. Sue says, can vaginal Valium suppositories cause yeast infections or possibly allergic reaction that feels like you have a yeast infection? It depends upon the base, hun, because they put the Valium in a base, and there's always a chance that you're reacting to something in the base. Danielle, I understand. Danielle says she hasn't been able to be intimate in several years. I understand that. Hello, Alexander, if you're watching. Jill from California, National IC Support Group Leader. Always happy to take questions. Yvonne, Sue says, I had the same problem, but just keep going with it after a week. Huge difference. You only need a small amount of estrogen cream to help. My doctor told me a pea size is all you need a day. Every doctor may tell you something different. My doctor also told me to use it on the urethra, just like my doctor told me. And Sue says, I actually have a thigh gap from losing muscle mass from getting ill with COVID. And it's not because I lost weight. It's because I've lost muscle mass. I never thought I'd have a thigh gap again. Well, you know. Danielle says perhaps a muscle is entrapped or causing something to burn. Absolutely. Or one side's tight and the other side's weak. Michelle says her son played football. How is physical therapy different than in women? Not much different, except you know, for regardless if it's a man or a woman, when you go to that pelvic floor assessment, they always start externally. They should have the patient walk up and down a hallway. Let's see how they walk. Um, they're going to measure the legs. Do we have one leg longer than the other? And of course, the job of the patient is to be really, really clear about their symptoms. You can't just walk in and say, I have pain or I have IC. That's pointless. You need to be really, really detailed. Do I have pain on the left side, on the right side? Is it shallow? Is it deep? What makes it better? What makes it worse? And again, with symptoms, the devil is in the details because, especially for pelvic floor, it's the weird random symptom that often confirms the diagnosis. So, do you ever feel like you're sitting on a cell phone on vibrate? That's a muscle spasm or a nerve fasciculation. Do you ever have sciatica? Do you ever have persistent genital arousal disorder where you feel this incredibly disgusting, painful arousal sensation in the middle of the day when you're shopping? And you don't want to tell anybody about it because you don't want anybody to think that you're, getting some sort of weird sexual thing, gratification out of this. That's just persistent genital arousal disorder. It's just a nerve that's being compressed. And so your ability to articulate your symptoms gives them a roadmap to study your body, right? So you really have to be thoughtful for several days beforehand and really pay attention to them and write them down. Do your symptoms change based upon the shoes that you're wearing? Do your symptoms change with body position? Do your symptoms get worse at the end of the day? Do you feel good in the morning? Does it get worse at the end of the day? Or do you feel bad in the morning when you get out of bed, right? Be as attentive as you can be. Then once they do the external exam, they will ask to do an internal exam. And that is the most important part of the exam. Because what they're going to do, with your permission, your laying on a table. You're not in stirrups, nothing like that. You just put your feet up and kind of flop your knees open. And they will stick a finger in the vagina, or for men, in the rectum. And all they're going to do is touch muscle groups. They're just looking for tension patterns. I mean, I hope that you can see with this model that the pelvic floor muscles in their normal position are lay along the inside of the bone. They're flat. But when they get tight, they lift up, right? So let's see. Okay, I have to do it. Okay, I have to do it this way. So these are your muscles in a relaxed position, but when they get tight, they lift. See that? They lift. And as they lift off of the bone, that's when they really start interfering with the other stuff that's going on in here, blood vessels, nerves, et cetera, et cetera. And so they're going to be able to feel very quickly if the muscles are in a good position or a bad position. One of the things that I found really interesting I've had physical therapy many, many times, I don't regret a moment of it. It was so helpful. Is I always thought it was interesting that she could actually touch the bone. Like she could actually touch the bone and it never hurt. There's no nerves in your bones that hurt. What hurt were tight muscles. A healthy muscle feels like a raw chicken breast. A tight muscle feels like beef jerky, and it's painful. And so now I do it at home. That when I start, you always know how your muscles are doing based upon how you pee. If you can go sit on the toilet and pee instantaneously, you're good. But if you hesitate 5, 10, 15, 20 seconds, or if your urine stream kind of goes all over the place, or you're stopping and starting, that means we've got something going on with the muscles. And that's when I go get my wand, I lay on my bed, put my feet up on the wall, and I use it. I use my wand internally, right? And I'm going to, let's see, right? Getting my hand position is hard. And so when I put my wand in, I know what healthy muscle feels like. It doesn't hurt. It's fine. I also know what tight muscle feels like because it's tender to touch. And that's where I'm going to go work. And so let's just say it's my left side, and let's just say it's back here, right? It's back here. Then I'm going to be focusing most of my time back here working on these muscles, just like I'm doing here. And for me, it takes about 2 minutes to get that muscle to relax and drop back down into position. Now, another, for me personally, harbinger of tight dysfunctional pelvic floor muscles is rectal pain. But it's not pain in my rectum. It's pain in the muscles by my rectum. So let's see. How can I demonstrate this? Okay. So we now have the levator ani muscles on, right? So here's your rectum. If I start feeling pain here or here on this side, and it feels like rectal pain until I put my hand down there, and then I just gently push in on my glute muscle, or on the inside of my glute muscle by my rectum, but not on my rectum. If that's tender to touch, then I know I've got to go do my pelvic floor, and I've got to work on releasing these muscles back there. So it kind of depends upon the pain, any pain that I have. If I sit too long here at the computer, I could have pain. If I sit in a car for too long, I could have a little bit of pain. And sometimes it's just oh gosh. Like COVID. Um I was coughing so violently that I let go. I leaked. I was shocked. I have not in my entire life, adult life, I only have wet my pants once. And that was after I got attacked by a dog and I fell down. Right? Years ago. I have never spontaneously wet my pants until the coughing episodes of COVID. And I absolutely feel like my muscles got tweaked in some way. And I'm not sure how, to be quite honest. I don't know if they're weaker. So, I mean, it's not happening as much because I'm not coughing anymore. Um, but I'm wearing a mini pad when I go. What? Oh yeah, 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 man. I was walking like 3 weeks ago, and I started coughing, and I lost a drop of urine. Life, right? Mary says, Jill, are you aware of salt is known to cause issues? It seems I have a salt trigger. Yeah, Mary, one of the earliest forms of torture is rubbing salt into an open wound. Back before we had our published diet list, we had a very simple method. Foods that were high in acid, foods that were high in salt, and foods that were high in alcohol were the ones that were going to be most irritating to the bladder. And let me just say, if you're postmenopausal and a woman, you're going to be more salt sensitive anyway. Rhonda says, you can put a TENS unit in that area and maybe get relief. That's true. You can. Gay said, my sciatica nerve pain, it tells me you absolutely have pelvic floor dysfunction. Mary says, estrogen feeds yeast. Sugar feeds yeast. I don't know if estrogen feeds yeast. Does estrogen feed yeast? Hold on. High levels of estrogen can also trigger an overgrowth of yeast. This is why you may also have more yeast infections when you are pregnant or on birth control. Man, you learn something every day. Doesn't say how, though. I don't think it's a food. I think what's confusing is the using the word feed. It doesn't explain it. Poorly controlled diabetes raises blood sugar levels, which easily feeds the growth of yeast. Excess moisture, like urine in the vaginal area, can cause yeast infections. This is from WebMD. I'll have to do some reading on that. Thank you, hon. Mary, thank you for bringing that up. Marlia says, the estradiol cream makes me burn. It makes my vagina feel all big and puffy. Well, Marlia, maybe you're having a reaction to the base of the estradiol cream. That's why I like the Women's International Pharmacy. They're really good working with different bases for people who are sensitive. I'm not surprised that you have a burning sensation. That tells me that your skin is probably quite dry. But the whole big and puffy sounds more like a reaction to something. Have you talked to your doctor about it? I would talk to your doctor about that. Alexandra says, do you take psychiatric meds for this disease? No, IC is not a mental illness. But there are two kind of mini exceptions, and that, Alexandra, a low dose antidepressant like amitriptyline helps calm nerves down physically. And so it's very common for patients to be given a low dose antidepressant to just chill the nerves out in the pelvis and in the bladder. Anti-anxiety meds, especially for those of us who have multiple pain conditions, which we know is driven by the central nervous system. And in that case, something like hydroxyzine, which is an antihistamine, which has a nice anti-anxiety side effect, commonly used. But if anxiety, the most common related condition that would be psychiatric in nature is just very high levels of anxiety. And we know, I mean, who wouldn't be anxious after experiencing pain and not getting a clear diagnosis? And especially if you're struggling with trying to understand it yourself and worrying about your life, worrying about your career, worrying about being able to be a good wife or a good mother. Of course, all of that is going to trigger heightened levels of anxiety. Whether it's cancer, whether it's IC, it is a life-changing moment. Temporary, but it is still traumatic to go through. But for those of us who have had long-term anxiety and who have multiple pain conditions, so for me, I had frequency urgency in 7th grade after I broke my tailbone, vulvodynia in high school, IBS in my 20s, really bad anxiety in my 20s, migraines in my 20s, weird sensitivities in my 20s, and finally bladder pain in my early 30s. That's really being driven by that old original injury to my tailbone that became an injury to my nervous system. And that started locally down in the pelvis, then that nerve sensitivity spread to the spinal cord, and then it spreads up to the brain. But we know exactly how to fix it. It's a very, very happy ending here. I don't have that anymore. I don't. For patients who are IC subtype 5, multiple pain conditions, what we're going to do is we're going to focus on treatments to get the brain out of fight or flight. When we get the brain out of fight or flight, it calms everything down. Everything down. Pain levels drop, muscle tension drops, and it's amazing how much better we can get when we start focusing on calming the central nervous system. Injury, trauma, not mental illness. They call it a central nervous system maladaptation. Danielle says, seeing how you're doing that, when I go to the bathroom, not to be graphic, but I have chronic constipation to the point where I cannot go number 2 by myself, so I have to use a glove. Perhaps I've damaged my own nerves. I have gloves too, if necessary. Pelvic floor, pelvic floor, pelvic floor, pelvic floor. If your muscles are tight, they don't relax easily for you to have a normal bowel movement. Constipation is a classic symptom of somebody with tight pelvic floor muscles. Also, the other challenge we have is our diets are so limited. Sometimes we don't get enough fiber, and we stop drinking because we think if we stop drinking that we're not going to have to pee enough. So then before you know it, you're pooping hard rocks, which is a sign of dehydration combined with not enough fiber. And so getting that fiber intake up is important. For me, it's all about fiber intake. If I have not eaten enough fiber, I'm going to be where you are. Also remember too, that tight pelvic floor muscles you might feel like you need to go to the bathroom, But when you glove up and stick it in there, there's not much in there. If anything, why? That's a tight muscle. Hey man, like I said, I'm willing to talk about anything. Rhonda said, I have a bladder prolapse. God, it never stops. Get burning pressure from it, and the nausea gets annoying. My belly really looks like I'm pregnant, finding it hard to stay on my feet. It's like a baby's head on the entrance. I have to go to the Euro. By Jay went, girl, you're going to have to work on getting that fixed or getting a pessary. Right? A pessary. Have you at least tried? I mean, so you guys, a prolapse occurred when muscles are very weak, right? There's injury, there's trauma, things are starting to fall out of position. And sometimes they start falling out, they start falling through here, right? And for some people with bladder prolapse or vaginal prolapse, things start hanging out of their vagina. There's like a round ball of ickiness down there that's actually your tissue coming out of your body. And that's awful. So the idea is to catch prolapses when they're very, very, very minor, because that's when physical therapy can fix it. But if the prolapse progresses to the point that the muscles are now stretched out, then you might have to do more. A pessary is something that you can place in your vagina that holds stuff up there so it doesn't fall out. You might be surprised to know that many elite athletes have to wear pessaries when they compete. That distance runners in the Olympics, a lot of them are wearing pessaries because their workouts over time have just damaged their pelvic floor. So they compete with pessaries. Pessaries are, again, lots of different shapes, lots of different sizes. You got to be willing to try them because that could make a world of difference getting that pressure off of your bladder and back where it needs to be. But at some point in time, there probably is going to be a discussion about a prolapse repair, a surgical prolapse repair to get your bladder up into the proper position. They used to do that with mesh, but mesh is tricky. Now they try to do it with your body's own natural tissues. So Rhonda, what has your doctor said about options here? Sue says, can vaginal Valium suppositories cause yeast infection or allergic reaction? Sure. Still trying to figure it out because symptoms come back when I continue with the suppository. So Sue, an interesting experiment. Now you have to remember, I cannot give any of you medical advice. You have to talk to your doctors about this. Do not do it because I'm saying you can do it. Some doctors, rather than giving somebody a vaginal suppository, just tell them to stick a Valium pill up there. I've never done that. I'm not saying you should do that. What I am saying is call Dr. Peters' office and say, hey, whenever I use my vaginal suppositories, I get some weird reaction. It doesn't feel good. How do you feel about maybe me just trying to use a pill up there? See what he says. I don't know what he would say, Sue. Alexandra says, how can I save my relationship when all the time I'm in bed and I can't do things and go out to the home? I complain and I've had suicidal thoughts. I have constipation too. I can't go to the bathroom. My belly is full of poops and I feel pain at the colon. All the time I feel my muscles and my nerves and my bladder can't relax. I can't move well and be functional. So, Alexandra, you are an anatomical mystery to be solved. Okay? That's it. Something is very clearly wrong with your pelvis. And your job now is to be Hercule Poirot. You have to be the detective and you have to be the director of your medical care. So this means there are going to be several things that we've got to rule out. So the first thing we really have to rule out is um, uh, what is the health of your pelvic floor? Concept number one, physical therapist, one visit, get in there. Let's see if your muscles are healthy. Because constipation is a classic symptom of tight pelvic floor muscles. And this could all relate to an injury you had years ago. The second thing we want to figure out is, why is your bowel being funky? So I had very severe IBS in my 20s. Girl, I feel your pain. I would eat something and 30 minutes later, I would have it almost explosive diarrhea. It was classic irritable bowel syndrome. So with irritable bowel syndrome, you can either have diarrhea, or you can have constipation, or you can rotate from diarrhea to constipation, diarrhea to constipation. And that was my group. I rotated from diarrhea to constipation. The first thing that really helped me, Alexandra, was doing a food diary. My sister gave me, let's see, I still have it. Yeah, look at this. Years ago, my sister gave me this book, The Best Guide to Allergy. Now, there are a lot better books now, but I have saved this book this whole time because I was just like you. But the thing, too, is that I had moments when I was just very ill. I called them my sick all over days. I couldn't tell you why I was ill. I was just ill. I just felt terrible. And what this book said is do an elimination diet. So the first thing it said to do is eliminate all dairy. So I still don't drink milk years and years and years, like decades later, right? I stopped all the dairy. And I could tell that when I ate dairy food, that my stools were more mucousy and painful. So that was concept number one, was losing the dairy. Then the second thing it said to do is lose the grain. So stop the wheat, stop the oat, keep the rice, because most people are fine with rice, but it said stop all the other grains. So stop the wheat, stop the corn, stop the oat. Now, girl, I got to tell you, for years, every morning, I was in the fetal position in my bathroom with these terrible bowel spasms. And my doctor said, you're just not eating enough fiber, eat oats. So believe me, I ate oats every day. I had oatmeal in the morning. I put oat flakes on my salad. I had oats throughout the day, getting sicker and sicker and sicker. This book said, stop the wheat, stop the corn, stop the oats. The next morning, I didn't have spasms. It was shocking to me. Wait, what? I stopped the grains. The bowel spasms stopped immediately within a day. Mind-blowing. And then the book said, okay, now reintroduce them one at a time so that we can figure out which one's getting you. So I reintroduced the corn, fine. Reintroduced the oats. Oh my God, it came back in an instant. And this book explained that it's not just an allergy. Sometimes for some of us, because when you have an allergy, you know, your throat swells, you break out in a rash. That wasn't happening to me. I was having a sensitivity reaction. This food was like a toxin in my body. My body was reacting to it like it was poison. And so that was absolutely life changing. So when I did my diary and I did my elimination diet, I got to see oats killed me. And the other thing that killed me was two other things killed me: chocolate and sunflower seeds. So once I stopped those, the bowel spasms went away. Okay, they did. Avoiding diet, I mean, just this food diary for your bowel, everything. Okay. So, and she said, I mean, we have on the IC Network website, icnetwork.org, how to do this. So, tracking cause and effect was important. So I got all the bowel spasms to calm down for many, many years, many years. So, and the other thing I don't like, I don't like cereal in the morning. I always felt bloated and gassy after eating boxed cereal. So I stopped boxed cereal back in my 20s. I eat a real breakfast. I mean, I have Ezekiel bread, I have eggs. I made gluten-free pancakes for myself this morning. And the other thing that I feel better if I go more gluten-free. Um, I get less bloated and gassy. I just feel a little bit better gluten-free. I mean, the only time I'm going to do stuff like that, gluten, is maybe sourdough bread, French bread, every now and then. But mostly I'm gluten-free or I eat Ezekiel bread. Okay, so that went on for several years. Bowel calmed down, everything calmed down. But then I started struggling with really severe rectal pain. And my rectum was on fire and my bowel movements were hard rocks. And I go to the doctor, they take a little scope, they go in there, yeah, look at that, you've got a little internal hemorrhoid. And it's like, Jill, it's the size of a sunflower seed. We would never treat this. This is tiny. And I'm like, it feels like it's on a nerve. Treat it. And they're like, no, we're not going to treat it. And I had the best appointment of my life ever was with this IBS specialist. And she was fantastic. She spent like 2 hours with me. And she said, how many grams of fiber do you eat a day? And I went, I don't know. Nobody's ever asked me that question. But I'm sure it's good. I have a great diet. And she goes, well, for you to have normal bowel movements, you need to eat 20 to 25 grams of fiber a day. So I want you to go home and I want you to look at the labels and I want you to count up how much fiber you eat a day. And she gave me this great list of high fiber, the fiber in food. Like, I thought, if you think eating a salad is high in fiber, you're wrong. There's only 1 gram of fiber in a cup of lettuce, whereas there's 16 grams of fiber in a cup of peas, green peas, right? So anyway, she sends me home and she says, I want you to email me. I want you to go look at your diet, look at the labels, and tell me how many grams of fiber you eat a day. Six. I was only eating 6 grams of fiber a day. That's it. That's why I was trying to pass rocks with bowel movements. Not enough water, not enough fiber. Once I got myself up to 20 grams of fiber a day, and I usually do that with peas or beans, which I love anyway, I'm fine. I mean, I have normal bowel movements. The vast majority of time, I have normal bowel movements unless my muscles get a little tight. So working with a gastroenterologist who specializes in IBS would be completely reasonable. So that's the two things. You're going to have to check the muscles out, and we got to make sure that you're doing everything you can to have really good, healthy bowel movements. People with IBS also, we don't do well with psyllium husk. We don't do well with bran cereals. We don't do well with granola. Yeah, you might have good bowel movements, but they're going to be icky and painful. We do better with smooth muscle. I'm sorry, not smooth muscle. Water soluble fibers. Heather's tummy fiber. This is what I use when I'm starting to feel a little stuffed up. And you can get this here in the IC Network store. It's made specifically for people with IBS. And hun, listen, for anybody out there, I understand why your brain starts to think it would be easier to not be here, because I did that too. But you're precious. There's only one you, and we need you, and your family needs you, and your friends need you. If you are struggling with suicidal thoughts, you need to tell your doctor that. I told my doctor, because that will help them understand how severe your pain is and how much you're being affected. And most importantly, it will get you the help you absolutely need and deserve, because doing this alone is very hard. It's very painful, especially if you have people in your family who are not supportive. If you have people in your family who are rolling their eyes, saying, "Oh, just drink cranberry juice," saying, "Oh, haven't you outgrown that yet? You're suffering, you need help, you deserve the help, and you have to have people to talk to. And you need to open your drapes, get the sun in. No shame, no blame. Look people directly in the eye. I am hurt. This is not all in my head. I am hurt. And just as if somebody was hit by a car in your home, you would run to their aid. You deserve the same aid too. But if it's the middle of the night and you're really struggling, you need to call your suicide hotline, because they're the best. They're experts. They're there for you. And sometimes just being able to talk to somebody for a half an hour or an hour who can kind of walk with you during these moments, and they know the best resources in your community. They know where the best pain doctors are in your community. They're the ones who have worked with so many pain patients just like you who are struggling and need support. So you deserve the best in life, and you deserve the best support. And I am not an expert in suicidal thoughts. So if you were on the phone with me, I would send you to an expert. And I just want to say to you, I have been there, honey. And I also lost someone I dearly loved to suicide. And if I could have gone back and tried to stop that, I would have, because lives were shattered because of it. There's a great website. It's at metanoia.com, metanoia.org. And let me just, I just want to read this to you. This service has been around for a long time. I'm going to put a link in here. They were one of the first to kind of help with online therapy. And they have a fabulous page that says, if you are suicidal, read this first. And I'm going to give you this link also. And I have sent thousands of people to read this over the years. And I read it too. Here, hold on. Okay. So I'm gonna read this whole thing, okay? If you're feeling suicidal now, please stop long enough to read this. It will only take about 5 minutes. I do not want to talk you out of your bad feelings. I'm not a therapist or other mental health professional, only someone who knows what it's like to be in pain. I don't know who you are or why you're reading this page. I only know that for the moment you're reading it, and that is good. I can assume that you're here because you're troubled and considering ending your life. If it were possible, I would prefer to be there with you at this moment, to sit with you and talk face to face and heart to heart, But since that is not possible, we will have to make do with this. I've known a lot of people who wanted to kill themselves, so I have a small idea of what you might be feeling. I know that you might not be up to reading a long book, so I'm going to keep this short. While we are together here for the next 5 minutes, I have 5 simple, practical things I would like to share with you. I won't argue with you about whether you should kill yourself, but I assume that if you're thinking about it, you feel pretty bad. Well, you're still reading, and that's very good. I'd like to ask you to stay with me for the rest of this page. And I hope it means that you're at least a little tiny bit unsure, somewhere deep inside, about whether or not you really will end your life. Often people feel that even in the deepest, darkest of despair. But being unsure about dying is okay and normal. The fact that you are still alive at this minute means you are still a little bit unsure. It means that even while you want to die, at the same time, some part of you still wants to live. So let's hang on to that and keep going for a few more minutes. So start by considering this statement. Suicide is not chosen. It happens when pain exceeds resources for coping with pain. I'm going to repeat that again. Suicide is not chosen. It happens when pain exceeds your resources for coping with pain. That's all it's about. You're not a bad person or crazy or weak or flawed because you feel suicidal. It doesn't even mean that you really want to die. It only means that you have more pain than you can cope with right now. And if I start piling weights on your shoulders, you will eventually collapse if I add enough weights, no matter how much you want to remain standing. Willpower has nothing to do with it. Of course, you would cheer yourself up if you could. Don't accept it if someone tells you that's not enough to be suicidal about. There are many kinds of pain that may lead to suicide. Whether or not the pain is bearable may differ from person to person. What might be bearable to someone else may not be bearable to you. The point at which the pain becomes unbearable depends on the kinds of coping resources you have. Individuals vary greatly in their capacity to withstand pain. And when pain exceeds pain coping resources, suicidal feelings are the result. Suicide is neither right nor wrong. It is not a defect of character. It is morally neutral. It is simply an imbalance of pain versus coping resources. And you can survive suicidal feelings if you do either of two things. Number one, find a way to reduce your pain, which I'm here for with you, or find a way to increase your coping resources. Both are possible. Now, I want to tell you about five things to think about. Number one, you need to hear that people do get through this. Even people who feel as badly as you're feeling right now, statistically, there is a very good chance that you are going to live. I hope this information gives you some sense of hope. Number two, give yourself some distance. Say to yourself, I will wait 24 hours before I do anything, or a week. And remember that feelings and actions are two different things. Just because you feel like killing yourself doesn't mean that you have to actually do it right this minute. Put some distance between your suicidal feelings and action, even if it's just 24 hours. You've already done it here for 5 minutes just by reading this page. You can do it for another 5 minutes by continuing to read this page. Keep going and realize that while you still feel that way, you are not at this moment acting on it. This is very encouraging to me, and I hope it is to you. Number three, people often turn to suicide because they are seeking a relief from pain. Remember that relief is a feeling, and you have to be alive to feel it. You will not feel relief you just so desperately seek if you have passed. Number four, some people will react badly to your suicidal feelings, either because they are frightened or angry. They may actually increase your pain instead of helping you, despite their intentions, by saying or doing thoughtless things. You have to understand that their bad reactions are about their fears, not about you. But there are people out there who can be with you in this horrible time and will not judge you or argue with you or send you to a hospital or try to talk to you out of how badly you feel. They will simply care for you. Find one now. Use your 24 hours or your week and tell somebody what's going on with you. It is okay to ask for help. Try. You can send an anonymous email to the Samaritans. You can call the National Suicide Prevention Line. You can make a text. You can look in the front of your phone book. Do we even have phone books anymore? You can call a psychotherapist. Carefully choose a friend or a minister or a rabbi, someone who is likely to listen. But don't give yourself the additional burden of trying to deal with this alone. Just talking about how you got to where you are releases an awful lot of pressure, and it might be just the additional coping you need. Number 5, suicidal feelings are in and of themselves traumatic. After they subside, you need to continue caring for yourself. Therapy is a really good idea. So there are various self-help groups, both in your community and on the internet. Well, it's been a few minutes and you're still with me, and I'm really glad. Since you made it this far, you deserve a reward. I think you should reward yourself by giving yourself a gift. The gift will be a coping resource. Remember, back up near the top of this page, I said that the idea is to make sure that you have far more coping resources than you have pain. So let's give you another coping resource or 2 or 10 until they outnumber your sources of pain. And now she says, now I'd like you to call somebody. While you're at it, you can still stay with me for a little bit. Check out these resources for online help. And then there's a bunch of links to a bunch of different articles on recovery, on all this, how to handle, it's just fantastic page. So for anybody who's having any suicidal thoughts, and you please share this with anybody else. This website at Metanoia Suicide, read this first, is wonderful. I found it when I was having suicidal thoughts back in the early 1990s. And there is hope. There is hope for patients with long-term chronic pain. Generally, what that means is we've missed something. Is there a Hunner's lesion? Is there a tight pain, a messed up pelvic floor muscle? And so you don't have to pretend. It's okay to have moments of weakness. It's okay to ask for help. It's okay. I remember I told my sister back a couple years into my diagnosis, I said to her, because I didn't have hope back then and I wasn't better. I said to her, when mom and dad die, I'm just going to die. Just be prepared. When they're gone, I'm going to go. Because I didn't have anybody back then but my parents. And I couldn't drive myself to the doctor. My father or my mother did. That's how bad my pain was. And I think that was the moment that my sister understood that I was truly suffering. And she did an amazing thing because she went to my parents and said, we need a plan to help Jill if she does not get better. And they created a trust for me. Now think about it. 40 years later, I am completely pain-free, and I just spent the last 20 years caring for my parents so that they would be pain-free. And I lost Earl who was a dear friend who had cancer. And I vowed I would never, ever, ever do that to the people that I loved after I saw what happened with him. Now, Alexandra writes, I don't have parents to care, honey. You have everybody in this meeting. You've got thousands of brothers and sisters who share your journey. We are walking side by side with you right now. If I wish right now I could give you a hug, look you in the eyes, and give you a little tiny shake and say, you're not in this alone anymore. We are here. We have been through it. We want to help. You don't have to do any of this alone. We are together. And that's the great thing about the IC community, is this community is united. It is united. And as Renee said, there are days, one day at a time. Like some days it's 1 hour at a time. But in the end, I mean, like the moment that truly changed my destiny, Alexandra, was when I was at the freaking emergency room. And I had a doctor say to me, you will forever be a burden on your family. You will always live with severe pain. Get used to it, Jill. And I looked at him and I went, wait a second, dude. I didn't say dude. Wait a second. This is below the waist, not above the waist. I still have my brains. I still have my hands. I still have my heart. I will prove you wrong, you son of a bitch. How dare you say that to me? And that was a moment I went from being depressed to being pissed. And I went home and I started studying. I read everything I could read on IC. And then, and listen, my favorite affirmation, be bold and mighty forces shall come to thy aid. I picked up the phone and I called the experts. I emailed, I called. I wanted to learn. And I pissed off people. I pissed off the ICA. Who is this Jill? Somebody said, you have the audacity to call Rob Moldwin? Yeah, absolutely. Who the hell do you think you are? I'm trying to get better. Started a support group, started the IC network. Knowledge is power. And you know, like I need you to be fierce about getting your life back. And part of that is reading so much so that when you walk into the doctor's office, you have total control over that discussion. You can never walk into a doctor's office and say, you know, I have IC and burst into tears. It will never work. You have to walk in knowledgeable about, okay, here's the deal. I struggle with constipation. I struggle with bladder symptoms. I'm confused as to why it is persisting, but I've done my homework. And so I am here with my pelvic floor physical therapist because I'm curious. I want to know if my muscles are involved because it feels like my muscles are involved. I feel tension down there. That's and so you're directing what they're going to do because your job is to harvest their knowledge. Your job is to harvest their diagnostic skills, right? So visit number 1 with the physical therapist. Visit number 2 with the gastroenterologist. I am struggling with constipation and this weird feeling. Whatever it's like, for example, one of the things that has happened to me, that happens to a lot of people, is something called packing. Packing, where your stools are, so you know that a perfect bowel movement is a long, flexible bowel movement. If you have a 12-inch bowel movement that, as it's coming out of you, kind of curves into a S shape, they consider that perfect. That's very fleeting for me. That's very fleeting for me. I'm more of the sections, right? Packing happens when you have a lot of small, hard stools. They're not big enough to trigger that voiding. And so what happens is that they end up collecting in your rectum. And by the end of the day, you really feel really full in your rectum, but you can't poop it out. You're like, it's there, but it's not coming out. And you strain, but it's not coming out, partially because it's small and partially because there's kind of a lot there. And that's where, an enema is just gold. Using an enema, just getting some water in there, 30 minutes later, you're done. You're unpacked. Or like for me, I have that silly, stupid little hemorrhoid in there. And if anything is touching that hemorrhoid, I feel it. So if I go to bed and I feel this niggling little rectal pain, I know exactly what it is. I go to the bathroom, glove up, KY, pop it out, done. 2 minutes later, I'm back in bed, right? So anyway, when you're going to the gastroenterologist, it's like, okay, I'm trying to figure this out. This is what's happening with my stool. I feel pressure. I feel like it's there, but it's not coming out. And also, too, there's a bit of a wake-up call when these happen with respect to our diets. Because sometimes, and honey, I don't know how old you are, a lot of us when we're younger get used to a very junky diet. And when you're young, your body's resilient. It can kind of cope with that. But girl, once you're in your 30s, 40s, 50s, there's a reality check that no, eating chips all day and eating fast food all day, it's just not healthy. It's going to cause issues. We have to go back to making really good life decisions about really good, healthy food. So my diet now that I'm not caring for my elderly parents is, I'm perfectly happy with sauteed vegetables, tofu, and rice. I could eat that every day and I'd be fine. I had chicken salad. I have chicken salad for tonight and a little bit of potato salad and jicama, something like that. So, girl, embrace your fierceness. Let's get your knowledge level up. You can see that there are people who have gotten better. You get a lot of people in this room. And for every patient online having a bad day, you got to remember thousands are having great days. And I want you to stay out of the Facebook support groups because they're very depressing. There are some Facebook support groups that are very discouraging and they have a lot of conflict. Facebook is not the place for you to be. You can watch my live meeting. That's fine. But some of the discussion groups on Facebook are very depressing and very hurtful. Not the place for you to get your emotional health back. I'd rather you turn off social networking and call and talk to somebody. Ask action satisfaction. Don't be embarrassed. I'm going to start therapy again just to deal with the grief of my parents. I'm going to do it. Jill says, oh, it's always nice to meet another Jill. Just seen you were alive. I had a horrible flare for a few days, which kept me awake all night Thursday, but I listened to you talking through the long hours and felt not so alone with the pain. I just want to say thank you for your meetings. Are great comfort. Oh, honey, you're very welcome. And I hope your flare is better. So what do you think triggered your flare? Was it something you ate? Was it something in your muscles? What do you think triggered your flare? Rhonda says, oh, Jill, thank you for showing real emotion. Yep. Sue says, I have a battle to fight right now about a bad doctor actor at a time in my life when I am fragile. It has paralyzed me. I told myself every day I'm going to leave this house and go do something, yet I cannot because I'm still trying to process something I wasn't prepared to fight, but I am struggling, trying to prepare myself for the fight ahead. It's something I cannot walk away from because so many people were harmed and some of them were children. Pray for strength for me to get through this. Sue, girl, you've got this. You're a tough bitch in the best possible way. And embrace the nobility of your cause. You're going to make sure that somebody who hurt you will never hurt anybody else. And your story should never have happened, but it's not embarrassing. You shouldn't have any embarrassment about it. You shouldn't carry any shame about it. That asshole hurt you, and he hurt a lot of people, and he's going to pay for it now. And F him for what he did. You know what I mean? So I want you to lift your head with pride, look in the mirror with strength, with confidence. You're a tough bitch. And you're fighting for right here. You're fighting for goodness. You're fighting to protect other people. And I want you to open your front door and I want you to walk out to the street. Get yourself out. Practice. The more you do it, the easier it's going to be. Because in the end, none of this was ever about you. This was about somebody doing very bad things. And you know, I'm looking right at you because I love you. And you've got this. You're going to be so proud of you. So proud of you for speaking up. And I think in the end, Sue, listen, there are some people, you know, I mean, I've met thousands of patients over the years. And there are those whose stories I will always treasure for your courage, for your strength, for your endurance, and for the person that you are. And you're one of those people, Sue. You're one of those people. I will never, ever forget you. Nor do I ever, we're just going to be friends from this point forward. You know that. You were so nice to me when my parents died. And I want to return that favor to you in any possible way. So if you ever need a pep talk, you know who to call. Okay, hon? And Boria says pain is ridiculous. Yeah. Sue says Facebook groups are big pity parties. Yeah. Well, that's the problem with Facebook early on. You know, I mean, back before Facebook, you know, every IC patient came to the IC network. We had hundreds of thousands, 200,000 patient visits a month on the IC network. And I ran it and I trained everybody who worked for me and volunteered for me. And so our group was very safe and very protected. And we had rules and people had to follow the rules. They had got a couple of chances, but, you know, and my philosophy as a group leader is my opinion. It's the least important opinion in the room. That my job is to try to help you guys talk and share information. And if we were doing a live meeting, you would see that. It's a little bit harder online because I'm talking. And so, you know, my experience comes out a lot. The problem with Facebook groups, it's the leaders are just not trained. And they don't know what to do with a suicidal person. And they don't know what to do with fights and things like that. And I get called, people will email me and say, hey, we've got somebody in this group who's suicidal. Can you step in? And it's like, I don't have privileges in that group. And you need to get that group leader working and use the Facebook referral system. David said, if anybody needs to text, you can message me your number. I'm having a hard time right now and having a hard time getting to sleep, so I'm up late. No. Danielle says, you're truly God sent with everything that you've been through. Thank you. It's the only reason why it's the only way I can understand why my life was my life. Thank you, Jill, for your dedication. You're a true gift. Thank you. Jill says, possibly muscle spasm, muscle tension combined with IBS. Yeah. Feels like a bad UTI again, but because of what I've learned from you, I could rationalize it was nerve muscle. Listen, I had, after my folks died in May, and of course the stress and trauma and tears were endless. I mean, I didn't stop crying for 6 weeks. And I still cry randomly all the time. And I said to my sister, I said, well, we're going to be the perfect case study for what severe trauma and stress does to pelvic pain. And I had 3 flares. And they were bad. They were short, but very bad flares. 3 times I woke up and I had to pee every 5 minutes. Now, of course, crying uncontrollably, you can imagine what that does to your pelvic floor. And I was crying uncontrollably. So I knew what it was. I knew exactly what it was. Even though I was peeing every 5 minutes, and even though it hurt, my bladder was hurting, I knew it was my muscles. So I went and got my wand, did my internal pelvic floor work, and within 10 minutes, I had stopped the flare. I could feel the muscles were massively tight. And once I got the muscles released, the flare went away. And I had to do that 3 times in a period of 6 weeks. Wicked, wicked muscle tension. So Brea says the pain it can be, yeah. But we got to figure out what's triggering that pain and deal with it. Alexandra says, you're my friend now. Thanks for sharing. I feel like I'm not alone. We are warriors. I send hugs and love. Absolutely, girl. Absolutely. Sue says, your face is empowering and knowledge. I just wish I would have found it earlier. Maybe things would be different for me. Girl, listen, God has his own plans. The fact that we met is just great. And I wish, Sue, girl, listen, like there are 2 things that I want to do. I would love to ride horses again because I grew up with horses. But I also know that I have a pelvic floor injury and I have a pudendal neuralgia. And the worst thing I could possibly do is get on a horse, right? But I love barn crew. I think that I should be volunteering in a horse rescue place somewhere. The nearest one's too far away from where I am. And I think you're doing exactly the same thing. There's just horses, being with horses, grooming horses, watering horses, feeding horses, dividing flakes of hay, giving them grain, leading a horse, leading with a child on their back. I mean, that's just heaven. That's just heaven. I would just love to do that again. And the other thing that I think I am going to do is I am going to go play tennis. I'm going to go try to play tennis with a friend of mine. I'll call him and see if he's willing to hit a few balls with me, and we'll just see what happens with the pelvic floor and the SI joint. I just don't know. But I am 63, and I do accept the fact that I do not have a body that's in my 20s anymore, and I have to be realistic in my expectations. And if that means I'm just going to go have some fun, I'm just going to go have some fun. You know what? If I want to hit balls for 10 minutes, I'm going to go hit balls for 10 minutes. It is what it is. All right, guys. Well, we've been going for about 3 hours, and I think this has been a really good meeting today. I hope it has been. You guys make me feel good, and I hope that I've been able to make you guys feel good. If you find these meetings helpful, please think about coming on over to the IC Network website and becoming a member so you can get our magazine. And or if you want to get any supplements or anything like that, they're all in our shop. I have to be really honest and tell you that this has been a terrible year for us because of inflation. And the shipping prices have gone up, and everybody wants free shipping. And unfortunately, we as a small business can't afford it. And so you go over to Amazon, and you get the free shipping from there, they still charge me for your shipping. So it's always hard. I spent about an hour with somebody on the phone last week, and we were just talking about a lot of different things, and she wanted to get a supplement, and I was like, okay, here it is, and the shipping was $10 or something like that for what she wanted. And she goes, that's too expensive. I'm going to go over on Amazon and get it for free. And I was just like, did you see any value in the fact that I just spent an hour with you, talking with you? I didn't quite say it like that. And it's like, anyway, I hope you know what you're trying to say. It's been a rough year. And so if you could give us a little bit of love by buying some of your supplements or low acid coffees or chair cushions or anything like that from us, that would be great. Renee says, I'm going to check into your Carob. So Renee, we're now officially at the point where we're really not going to be able to ship Carob candy, but we will be able to ship the Carob brownie mix and the Carob cake mix. So it should be fine in the heat, but it's just too hot. So we still have some. If you're in California on the West Coast, we can probably get it to you. If you're on the East Coast, Carob candies are going to be rough to get to you in the heat, which is bad because what that means then, if I go up into my warehouse, you know what's going to happen is I'm going to get a Carob sea salt coconut bar, and I'm going to eat the damn thing because it's so good. I cannot not eat it, which is so frustrating. So you can tell I'm losing weight. I've lost a lot of the weight I gained during COVID, but the Carob brownies are awesome, and the Carob cake is awesome for those chocoholics who can't do chocolate. I don't like chocolate. I associate chocolate with very severe pain, so I don't eat chocolate. There's nothing in my body that wants chocolate. But Carob I can eat all day, every day, and it's so good. Marlia says, I wish I could ride again. I trained show horses for 20 years. Arthritis, now can hardly walk. I want to volunteer at Sunshine Horse Rescue. Knees say no, depression is real. So you, Marlia, you need to hang out with Sue, because Sue also was a competitive horse rider. We did 3-day events and pony club and jumping. But just, again, I was more barn crew. I only did a little bit. It just wasn't, I wasn't talented like my sister was. Renee says, go where to order. At the IC Network website, there's a link in the upper right-hand corner that says store or shop. Just go there and it will take you over to our store website. David says, Jill, you look great. Hey, the advantage is that my right eye isn't swollen shut today like it was last Sunday. My eyelids looked like donuts, and they were like this. It was hysterical. And it was all from me getting my eyes checked for new glasses, and I got a freaking infection. Jill says, can you ship to the United Kingdom? A few years ago, I ordered some supplements. There was a big import tax. Jill, the only workaround we have for you is you need to make friends with somebody here in this support or in Facebook here in the United States and let them order it for you. So we can ship it to them, and then they can send it to you as a gift. So as an example, let's say you know somebody in California and you want to get a bladder rest and Peoria, something like that. We'll be able to ship it to them first class for like $6. And then they can ship it to you as a gift. We can't ship it as a business to the United Kingdom because we have to have an import form on it that identifies everything you bought and the price you paid. And that's where they charge VAT. But they don't charge VAT for gifts. That's the only workaround I have for anybody in the United Kingdom or Europe. It's terrible. It's just terrible. So, make some friends with somebody. And if there's anybody in America here who might want to try to help some of our United Kingdom customers, think of yourself as a third-party seller, or a third-party shipper. You could potentially say, yeah, I would do that for you if you give me $2, and that's a deal. But friends wouldn't do that. But anyway, just you guys just think about it. And Marlea, listen, you can go watch the horses. There's still horse shows. Try to go watch, even if it's in a wheelchair, even if it's with a walker. We have a polo club nearby us. And I was never into hoity-toity polo clubs, but I was hiking over there and they were playing polo, and I just stopped and I watched the horses, and it just made me very happy. Jill says, thanks for explaining that. I might be able to sort something. Yeah. Danielle says, I hope that you received your stars now. I know how to send them. Thank you, honey. Another way you can support us is with stars. Yeah. Yeah, 7 p.m. on the East Coast, 4 o'clock here in California. All right, my friends. Well, I think this is a good place to stop. Good meeting. Just big, giant hugs. Hugs to everybody. These are the new younger kid hugs. For those of us who love BTS, that's what this is. This is a hug. Mondays are my day off usually. Although I usually answer the phone afternoon if I can. So if you feel like you want to call and talk, it's first come, first serve, okay? Marlia said, thanks, Jill. I would go to the regional Morgan show here in Syracuse in September with a cane. Hey, hon, we had a Morgan. His show name was Friar Tuck. We called him Brownie. And it was a damn smart horse. Whenever we wanted to ride, he started coughing. And it was a fake out. He just figured out that we wouldn't ride him if he started coughing. He eventually got navicular disease. So we had him for a good long time. All right, guys. Oh, let's see. And again, YouTube, I'm sorry. Let me just check my email, see if there's anybody on YouTube who sent anything. Yeah, we have one. Okay. Okay, Deb, I will send that to you either tonight or tomorrow. Okay? Not a problem. All right, guys. I'll see you later. Have a good one. Marlia says my Morgans were the best. They are, right? I love my Morgans. Mary says, going to news outlets, making some noise. Go for it, girl. But you could save it for IC Awareness Month to bring the press release, which I will write once we decide on a theme. I think the tailbone injury is maybe we should just do tailbone injuries. I bet I could get a good quote from a doctor on that. I bet I could. So, all right, guys, I'll see you later.